All right, so good morning, guys. Let's get started. Today we're going to discuss gastrointestinal conditions. We started this a little bit last week, but I'm going to review it again quick. This is one of my favorite areas. I'd say you could build your entire practice on just this lecture, frankly, because a lot of the patients that I attract are ones with food intolerances, ones with heartburn, IBS, gallstones, gut flora issues, constipation, diarrhea. Like, this is what we do, and I think naturopaths are good at this. Now, I want to just say that in treating gastrointestinal disorders, herbal medicine is a very useful tool, but it's not the only one. And I'm going to go through and just explain again the general approach that I do with any kind of food, almost anybody who comes into my practice. I go through this general approach depending on what they're doing. I always do a little mini elimination diet with them. And I have a little handout called the red flag foods that I get people to remove. And it's not a strict elimination diet. It's pretty doable, kind of a harm reduction approach to see how people do. I can be more strict if I need to afterwards. I can run a blood test if I need to, but I always start on the first visit getting them to remove food intolerances, and that would be 1, removing sugar, 2, removing yeast from their diet, which would be things like beer and bread that contain yeast, and switching it out for maybe distilled spirits, and like if you're going to have vodka soda is better than having a beer from a yeast standpoint, or for bread, I'd rather have them have yeast-free breads or wraps. Other foods would be, there's a couple fruits I get them to avoid. Bananas tend to cause a lot of bloating in people and can cause digestive issues, and I get them to remove that. It's not the best, healthiest fruit anyways. It's a little bit too starchy. Also, things like pineapples, too much sugar, dried fruits can bug people. I usually get people to remove corn just because there's a million reasons why I'm not a big fan of corn. That being said, I had nachos last night for dinner, so I do eat it as a treat, but it's not a healthy food and it does bug people. I get them to remove the whey component of dairy, so milk, cream, sour cream, ice cream, whey protein powder, any other things that contain whey. I get them to keep cheese in the beginning because most people like cheese and it doesn't usually affect them. If they are sensitive to cheese, I get them to have more buffalo cheeses or sheep and goat cheeses are better tolerated. I get them to remove eggs, egg whites in particular. And then when it comes to gluten, I don't always get them to remove gluten entirely, unless I suspect they have like a severe reaction or celiac or something. Often it's the yeast in the bread that bugs them. And so I usually get them to do rye and kamut, so rye breads and kamut wraps instead of having wheat-based breads. I get them to remove the yeast, and as I mentioned earlier, that tends to help. With regards to gluten-free pasta, I don't do gluten-free pasta. Some people do, some people don't. The alternatives are usually rice, which is generally safe, and also corn, which I'm not a big fan of. So durum wheat pasta. Durum is the type of wheat that's used to make pasta. It tends to be less irritating than wheat they use to make bread with. So I leave it in the beginning, and then if I need to, I'll remove it later on. So depends on the severity of the symptoms as well, and also what the patient tells me. But in general, I get people to do that for 2 weeks, and then we reintroduce things and see what happens. Now, as an aside, technically speaking, a person could react to any food. Rice is usually allowed on elimination diet, but like 1 in 100 people will be off the chart for rice, but they might be okay with dairy or gluten or whatever it is. So there is some challenges of doing removing food sensitivities, but having run the testing about 1,000 times, and there's controversial, the whole testing thing, but there are certain patterns you see with people, and that's sort of what I base those food removals with. So the herbs are supportive for digestive issues. In a lot of cases, if you can remove the food intolerances and just give them a healthy diet, they probably won't need to take herbs necessarily, but they still play an important role. We'll go through some cases, okay? Here are the herbal actions that we've discussed for the most part, I think. when someone comes in with a digestive concern, a good way to approach the case is you think about, first of all, what are the symptoms they're presenting with? So if someone has bloating and gas and have a heaviness when they're eating meals, then you're thinking to yourself, okay, I could use a digestive bitter with that. I could use a carminative. I know the bitters have cholagogue, choleretics, hylagogue effects. Those would be beneficial. If they've got sluggish bowels, I might want to consider using a laxative, preferably a bulk laxative. And if they're acutely constipated, go with a stimulating laxative, potentially, or an osmotic one. If they're getting cramping pains, these may resolve if I give them, if I get the bowels working better and promote digestion. But if not, you might want to give them the option to have a carminative or an antispasmodic. If they're feeling nauseous, you give them an antiemetic. If there's any kind of burning in the esophagus or stomach, you can give them demulcents. If you suspect they have an ulcer, you give them a vulnerary as well, maybe some astringents. I don't know if I have astringents on here. No. So you can add a few more things on there. So I'll start off with the first condition is indigestion. Now, indigestion basically it's just when people feel unwell when they eat. And there's a lot of symptoms associated with this. So generally speaking, people will say, oh, I ate something, just felt heavy, or I felt bloated, I was burping a lot, I got some reflux or some heartburn associated with it, or I felt nauseous. So there are lots of different symptoms associated with it, and people may not present with any one of these, or may present with one or more of these. And then the cause of indigestion could be if you just overeat Christmas, Thanksgiving, or you just overdo it with too much sugar. You eat, 3 pieces of pie for dessert. All those things are going to make you feel kind of awful. Also, if you have food intolerances, and even if you're eating normal amounts and in quantity wise, that can make you feel sick. And so identifying and removing the food sensitivities is beneficial. And if you're overeating and food sensitivities, that's a bad combination. Plus, if you had a sluggish digestive tract called atonic digestion, meaning the digestive system lacked tone, lacked stimulation, and that may be because of a number of different things. I believe we'll talk about that in a second. Then you want to help promote digestion. And then finally, in some cases, infections. Like if someone has an H. pylori infection, which causes stomach ulcer, it may just be in the beginning very minor, and it may just appear as indigestion, where they get some burning, a little bit of burning here and there, some burping, a little bit of heaviness in the stomach, and that's about it. Now, there's a type of indigestion. So indigestion, the medical term is dyspepsia. There's something called functional dyspepsia, and this is basically where there's no known organic cause to it. So person should have good digestion, but when they eat normal sized meals and they've been ruled out for H. pylori and everything else, they're having all these digestive symptoms. That's called functional dyspepsia. And I would say that's typically related to food intolerances and also to lack of digestive stimulus. So a few different things that I would do with that. Oh, here it is. I went a little more detail. So you may hear of stuff later on where people talk about someone that has hypochlorhydria, and this means low stomach acid. So generally speaking, when people have low stomach acid, this is often a cause of a lot of problems, including, ironically, heartburn. So a lot of medical doctors will talk about heartburn is because of too much acidity. But I would argue, and we'll come back to this later on, that it's not due to too much acidity in some cases. It's that the acid's basically going where it's not supposed to. And in some cases, if someone has poor digestive function, and this may be related to overall, they have insufficient stimulation. So when you eat a meal, generally speaking, what happens is there are certain cues that help to tell your body or digestive tract that food's coming. So I remember as a kid, I'd come home from school, and my mother was a teacher, so she would be cooking dinner around 4 or 5, whenever it was. So I'd smell the food. We'd sit down. We'd say grace. Even though I'm not religious, we'd say grace just because it's a nice little ritual to do. We'd sit at the kitchen table. We'd eat our meal. And so the smell, the routine, the rituals all surrounding eating and having dinner were all things that communicated, I think, to my digestive tract that food's coming. And so one of the things that happens to people is that if they're eating on the run, they're, eating between meals or at their desk while they're working, or in the car, or they're sometimes having a meal at 5 o'clock, sometimes they're not having dinner until 9 o'clock. All those things confuse your digestion. And what your digestive tract wants to do is it wants to optimize and be as efficient as possible. It wants to eat food at the same day. It wants to go to bed at the same day. It wants to poop at the same time every day. And when you have a crazy schedule due to stress or just whatever else it is in your unusual habits, or you're traveling, these can all affect your digestion. So if you're not getting those normal cues or stimulation, then that can occur. Also, if you're eating a very bland diet, so if you look at a Western diet now, we've kind of bred out all the bitter herbs. Now we're eating more sweeter things and more starch-based things and less bitter components. People aren't eating a lot of bitter greens. They may be eating too much sugar in their foods, and that bitter stimulus has been sort of removed, and that can also lead to atonic digestion, and probably in addition to your eating habits. Old age is another thing that just as we age, everything kind of becomes less efficient. So that can result in indigestion. And then with suppression, I guess it's kind of related to these things. Again, stress. If you're really stressed out, your parasympathetic system is going to be suppressed and your sympathetic system is going to be up. Also, with certain illnesses and medications, that can suppress your digestion. Now, what I typically see with atonic digestion is, in addition to the digestive function being impaired, you also see the bowels will tend to be a little sluggish. And remember how when you're promoting digestion, you're releasing bile, you're breaking the food down, all those things, and bile itself can indirectly act as a digestive, as a bit of a laxative. So if your digestion's sluggish, usually the bowels are sluggish, and so constipation goes along with that. If you're not releasing enough stomach acid, chances are you're, in addition to being hypochlorhydric, you're probably not releasing enough bile or pancreatic enzymes. And so that can lead to not just the indigestion, but can lead to gallstones as well. I think that sometimes people, if they have hypochlorhydria, if a naturopath says a patient has hypochlorhydria, they may supplement with stomach acid, betaine HCl. Betaine is just the carrier for the HCl, which is the stomach acid. But in my opinion, I prefer to stimulate the digestive tract rather than supplement with stomach acid or digestive enzymes, because in most people's case, you just got to get their body to work better. And you could always add betaine HCl, like the acid or the digestive enzymes on top of that. But I always like to start with stimulating digestion. Now, another thing that you sometimes will see is that often people with atonic digestion will often get reflux along with it as well, because when digestive function is impaired, the lower esophageal sphincter that separates the stomach from the esophagus doesn't always close, isn't as tight as it should be. And because you're not breaking down the food in the stomach as well, pressure builds up. That sphincter has to work harder to keep the food contained, or maybe the food sits in there for hours instead of 30 minutes or however long it's supposed to. And then you go to bed and you're going to get some reflux. So in addition to atonic digestion, where you have maybe some just heaviness and burping and bloating and feeling kind of nauseous with a meal, you can also get the heartburns, and potentially can lead to the formation of gallstones and also sluggish bowels. Okay. So how do I treat indigestion? I think this is a good way to represent the general approach that I take. I made these little slides up for people, for you guys, because I think it helps organize the thoughts we're describing and gives you sort of a way to look at cases. And so indigestion, I take the person's history. If it's a chronic thing, food sensitivities are going to be more of an issue. If it's just an acute thing, then could be something else. But regardless, I get them to remove some of the common food sensitivities for a couple weeks and see what happens. I typically give them digestive bitters to stimulate digestion. And by doing that, that's also going to help to increase appetite as well. And there's other things that can work to increase appetite, but bitters or ginger even, those would be the biggest ones, I would say. Digestive bitters or the aromatic bitters. Now, in some cases, because the indigestion is associated with heartburn and reflux, I might consider giving them something to protect the mucous membranes. And that would be some kind of demulcent. And there's a few different ways you could do that. Also, I think it would be wise to help people manage their stress through various coping mechanisms as well. So that might be something you do later on, or refer them to somebody who can do that for them. I get them to improve their diet in general, get them to eat less, serving sizes, have them eat more of the good fats, avoid the bad fats. Also, get them to have more bitter leafy greens in their diet, and avoid sugars and all those other things that we talked about. And then reducing nausea is also a part where I might use an antiemetic. Again, the ginger might be useful. So if that's a general considerations of how I want to help the person, again, here's the main things that I might consider doing. So bitters, stomachic, cold dogs, choloretics, those are all specifically to stimulate digestive function. Gentian, sometimes for a case like that, I may just give 30 ml bottle of gentian on its own and get them to have a few drops of it. You could also use wormwood or barberry. I prefer gentian because it's bitter, but those are ones that you can also use. There tend to be ones I use more for as antimicrobials, but they, if I ran out of gentian, I wouldn't hesitate to use. So I got a little message about a slow internet. I wouldn't hesitate to use wormwood or barberry, and there are a million different bitters that you could use. And those are just two of them. You could use chicory, you could use dandelion, you could use golden seal if you had to. There's so many you can use. So the fact that I'm only mentioning a few doesn't mean that this is what it's restricted to. These are just kind of the first few that come to mind, okay? Now, if there was some cramping or bloating associated with it, you could also recommend taking a carminative. So sometimes what I will do is I'll give them a small thing of digestive bitters, and then I'll say, look, if you get some bloating and heaviness after a meal, what you could do is you could make yourself a cup of peppermint and chamomile tea and drink that. And that would be one way that for a $5 bag of tea, they can just make it as they need to, and it's inexpensive, or they can pick it up when they're traveling. So that might be something. But those aren't the only herbs you could use. You can also use ones like fennel, anise, caraway, cumin. So if this happened at home and I opened up my medicine cabinet and I didn't have any herbs, and then I opened up my spice drawer and I happen to have cumin or caraway there, I might grind up a teaspoon of the seeds or half teaspoons of the seed, add some water, then drink that as a carminative. So I have things that I use 99% of the time in practice, but I know there are other options that exist. There's a question came up here. Christine's asking, can you use all these herbs in children, and how do you dose? There's a few different ways to dose with kids. My kids, I often will give them tinctures, and I don't really worry too much about the alcohol because I don't give them that much. If you were really concerned, you could add the dose to a little bit of water, boil it on the stove to get the water off, or use a glycerate. But for a lot of these, like gentian, my daughter loves it, and I don't know, most of my patients don't love it. My daughter likes it. I think she likes the alcohol, and I don't know why, but she'll go and take a few drops of that. We've got a little bottle of Angostura bitters in the liquor cabinet, and it's like a kind of a child size bottle of booze, and once in a while I'll see her she'll go into the cupboard and sneak in there, and I'll see her carrying around and taking a few sips. I'm like, dude, you can't do that. That's like, and so I don't recommend letting them drink as much as they want. But if you had them, let's say, sometimes I've given digestive bitters if they've had like sluggish bowels, just to kind of, even though it's a digestive bitter, indirectly can have a lasting effect in kids, and it can kind of purge things out. With regards to carminatives, I wouldn't give wormwood and barberry though. Those ones I would not give to children, generally speaking, unless I absolutely had to. The carminatives, you can do it. You can do it as a tincture, and if you don't want to do it as a tincture, just make a cup of tea with it, and that would be totally appropriate. Sometimes with the carminatives, what I've also done is I've ground up fennel and with a mortar and pestle, and or taken a few drops of the essential oils and added the coconut oil, and I've ground up chamomile flowers in amongst the coconut. Not coconut milk, but coconut oil, and then I'll leave it beside the bedside. So if one of the kids has gas, I'll just sort of reach my finger in and just rub it in their mouth, because sometimes I can't get the tincture dropping in their mouth, and sometimes I won't sip the tea if they're crying. So just taking these essential oils or pulverizing the flowers and grinding it up and adding it and suspending it in the coconut, because coconut's usually a semi-solid, like usually not liquid at room temperature unless it's hot out, and I can just sort of give them a little bit squirt from my hand. Last night, my son was, he had gas. He ate nachos too on the weekend. I think they were bugging him. And so he had gas last night. He usually doesn't, so I didn't have any of it made up. So I took a little piece of a fisherman's friend and just bit off a little piece and popped it in his mouth. And at 3 a.m. when I was walking around helping him, get through this little period of gas and colic, the fisherman's friend, he didn't like that. He wasn't too happy. My daughter didn't mind. He didn't like that. And so he was kind of coughing and splurting, and then he regurged and farted at the same time. And so it did give him a little bit of regurge, like he kind of spat up a little bit, but then he was better. So it opened the sphincters up at both ends, and he was good. And then I put him back down. So, and then ginger is pretty palatable. Even my daughter, I remember, I would just give her the ginger root, and she would just sort of gnaw on it. And when she was 3 months old, and it was a bit spicy, but I guess she didn't mind. She won't do it now, but she did it back then, and it sort of distracted her from the pain, and also would give her just enough of the essential oils to settle her tummy down. Now, not all kids are like that, but you can do that. So one thing you can do for dosing it in kids is you could just take the adult dose, take an average human, or not human, I guess children are still humans. You take the dose for an adult, which is recommended in the books, is probably going to be what would work for a 150-pound person ballpark. So if you got a 30-pound kid, you take the adult dose and you just divide it by 5. And that would be a reasonable way to do it. So if it's normally 50 drops, you drop it down to 10 drops. And you can always start off with less than that and then increase. So that's how I dose. Now that I have kids and I've just been dealing with them, they're not as fragile as I thought they were until I had kids. So, okay. My kids will drink chamomile and peppermint tea. A lot of kids won't though. So, demulcents, you can use that for your indigestion along with these other things, and it could be given. I've given sometimes someone a digestive tonic that has gentian and a little fennel, and I throw a little licorice and a little ginger in it, and I've done that in tincture form. So they're getting a bit of an indirect emulsient from the licorice, and I've even thrown chamomile in there. And so that's a tincture that works pretty good, and maybe take a half a teaspoon or a teaspoon. But you could also do one that had wormwood and peppermint, and I wouldn't use the slippery or marshmallow in that tincture though. And you could leave the ginger in or take it out, and it would still be good. Okay. So what I've done is I've included a number of cases that I've seen in practice. I haven't got them all in here, But here's one where I had an 83-year-old Italian woman. She had a lot of digestive symptoms, severe abdominal pain, occasional heartburn, bloating and gas. She also had arthritis and sluggish bowels, so she didn't have a bowel movement for every 1 or 2 days. So in her case, she probably had functional dyspepsia due to like an atonic digestion. She probably had some food sensitivities. She had some GERD with it. I suspected she had some lactose intolerance as well because she was drinking milk because it was good for her bones, apparently. And then she had sluggish bowels for the chronic constipation. So in her, remove milk, increase some fiber in her diet through either you could do psyllium or some ground flax and chia. And then I gave her a little bit of gentian, the tincture, before meals. So I didn't do a whole lot. Even though she had bloating and gas, I figured I didn't give her carminate off the start because I assumed that she had a milk intolerance, and I didn't do the full blown removing all the food intolerances I usually do in the first visit, just because it's sometimes harder with elderly patients because they may have. You got to keep it simple for them. So I started off very simple with her. Remove food, gave her, like I said, eat this for breakfast and take this herb. So when we removed the food, after we just did the food sensitivities, I suspected the first visit. So after a couple of weeks, her symptoms had basically gone from an 8 out of 10 down to a 5 out of 10. So they kind of plateaued after the milk was removed. And that's when I give the digestive bitter, the gentian. And then you can see it was at a 5 out of 10. And then over time, after a couple months, basically her abdominal pain had completely resolved. So she was having regular bowel movements. Her digestion was great. She wasn't getting heartburn. And so good results with that. Now the heartburn wasn't that. I could have given her demulcents as well for the heartburn and some other things, but for this case, it just wasn't necessary. Okay. Now, one of the things that I did when I graduated from the college, I was a resident at the college. I was also worked for the research department for a couple of years as well, and we had an electronic database where students put all their cases into, and then we could mine it for data. And I think they've discontinued that now. But so one of the things that I did was I went through the database and searched through all the patients that were diagnosed with indigestion or dyspepsia, and basically they used a scale for symptoms that was on a scale of 6 out of 6, not out of 10. So it's a bit counterintuitive. So 6 is the worst it could be. 0 is it's no longer there. And then looked at all the patients that were given a digestive bitter to see how much of an improvement there was over time. And you can see there's definitely a trend in these cases that fit the dyspepsia, in particular functional dyspepsia criteria that I had. So the bloating couldn't be due to menstrual issues and other things. And people in general got better. Now, not everyone symptoms completely resolved in these cases that I was treating or that I was looking at. And that may be like, I would imagine this guy at the top there, they probably didn't determine what food intolerances. They took the bitters. There's some improvements from the bitters, but I suspect that they didn't, some of these cases, they didn't look at the food intolerances and the food sensitivities as a possibility, or some of the other factors, okay? But the general trend is bitters help, but they're not everything, right? You need other things as well. And so they did some dietary changes in many of the patients, some probiotics and some glutamine, apple cider vinegar, fiber. So it wasn't just bitters, but they gave tinctures that contained gentian or gentian alone, okay? So another case, or another thing we'll talk about is heartburn. Generally speaking, I think we do pretty good with heartburn. Heartburn is usually the result of acid either burning the esophagus or the stomach, okay? So both of those two symptoms can result in heartburn. In the stomach, heartburn is generally caused by either certain drugs like anti-inflammatory drugs, aspirin, ibuprofen, things like that are called NSAIDs. Certain drugs for osteoporosis like the bisphosphonates. Also corticosteroids that are used as immune modulators, anti-inflammatories as well. So those medications are well established to cause stomach ulcers and heartburn. Also, if you drink too much alcohol, in particular like the hard liquor, it's going to disrupt the mucous lining in the stomach and increase heartburn. If you get an infection due to H. pylori, that can cause stomach ulcers. And then any kind of stress that's severe, and it could be a physical stress, stress to the body, even like really bad burns in your exterior can result in heartburn. Um, those are all causes for stomach ulcers or heartburn. So another one that I didn't mention there would be there's an autoimmune cause as well. And then there's possibly cancer and other things that can occur as well. But certainly these are the most common causes. And most people, it's usually the anti-inflammatory drugs are the big one, okay, or H. pylori. So if your stomach, what happens is in your stomach, you have cells that create mucus to protect the acid from basically coming in contact with the stomach wall. And so that mucus has things that kind of neutralize the acid. And if for some reason that there's diminished blood flow, or if you're suppressing the release of certain prostaglandins that are involved with maintaining the mucosa, or there's an infection that's basically drilled a hole in that mucus and it's compromising that protective insulating barrier, then you're going to get an ulcer or gastritis. So gastritis just means inflammation of the stomach. Now, people who tend to get heartburn after they eat meals and they get a lot of like food regurgitating into the mouth, or it could just be like heartburn more up in kind of above the esophagus up in here, is generally referred to as gastroesophageal reflux disorder, or GERD, or just reflux. And so there, it's not that you have too much stomach acid in that case, and in some cases it may be that you've got impaired digestion, so maybe your stomach acid is a little lower than it should be. And as a result, because the stomach's not working optimally, that lower esophageal sphincter isn't closing as well as it should. And that may be due to food sitting in the stomach too long, or build up of pressure, or maybe a lack of bitters in the diet, because bitters increase stomach acid but also tighten that lower esophageal sphincter. So that would be reflux. And some people, when they have GERD, they may not even have heartburn as a symptom, just as an aside. They may actually have like a dry cough or postnasal drip, because that acid's irritating the esophagus. And as a result, because the nerves innervating the esophagus also innervate part of the respiratory tract, it can cause a dry cough as the only symptom of like a silent heartburn, so to speak. Or because it's irritating the esophagus, the body tries to make more mucus to protect itself, and the mucus isn't exclusive just to the esophagus, but it's also in the sinuses and the lungs, and so it can also cause increased mucus in those areas as well. So with heartburn, the general approach that I would want to take with heartburn is, first thing you want to look at is removing the food sensitivities. So there are a whole bunch of different types of foods that could potentially bother someone. Obviously, spicy food is one of them, but even things like, I find that they have food intolerances to dairy or to yeast or to sugar. All those things affect sphincter tone and the rate of digestion and lots of other things. Anything that makes there be a buildup of pressure in the stomach is going to lead to more potential for reflux. Also, if someone has some types of allergic reactions to food, can also cause that heartburn as well. So remove culprits that are food-based. Increase the sphincter tone. So you want to try to, if it's reflux, you want to try to keep the acid from leaving the stomach. And I think some of the strategies is going to be, obviously, you want to prevent people from overeating and get them to avoid eating spicy foods that can aggravate it. But taking digestive bitters in general cause the release of gastrin. And gastrin, one of the things that it does is it signals the body to make more stomach acid, but it also signals the tightening of the lower esophageal sphincter. And so that's where the promoting digestion is kind of related to the increasing the sphincter tone as well. And also promoting digestions, going back to what we discussed earlier about managing the stress and ensuring that the person is eating at regular times and not overeating and removing too much sugar, because I think sugar tends to cause that lower esophageal sphincter to open up and slows digestion down, I think. I don't know. Also, you want to protect the mucous membranes, and so giving them some kind of either a mucilaginous herb or something like licorice or DGL that stimulates mucus production would be beneficial. Now, in some cases, I don't do this all the time because it's not really necessary for most people with reflux, but for heartburn in general, it might, if you haven't figured out what's going on and they're still not getting better from all the other things, you might want to reduce stomach acid. And there are, antacid herbs that can do that. Also, if it's severe enough, or sorry, if they have an infection, that needs to be ruled out as well. So if someone's not getting better after doing some of the basic stuff, I have to think to myself, maybe they've got an H. pylori infection, and they can rule this out by doing a blood test. Isn't the most useful because they can check for the antibodies against the H. pylori, and that only tells you whether or not the person's been exposed to the H. pylori. And most people potentially probably have some antibodies to H. pylori, but it may not necessarily be the cause of the heartburn, even if it comes back positive. If you do what's called the H. pylori breath test, where the patient consumes some radioactive sugar and then breathes into a little container that measures the release of a radioactive gas that's emitted, that's a better indicator of an active H. pylori release. Also, if they do endoscopy and they look at the stomach and look at for ulcerations, they can usually identify whether it's by H. pylori just by kind of looking at it as well. And then finally, you may have to give some herbs like astringent herbs that can help to basically heal up that ulcer and arrest the bleeding as well. Okay. So generally speaking, if you want to be conservative with heartburn, I would always start with a demulcent, because at least with the demulcent, if you began with that, you're going to make the person probably feel better. So giving them licorice or DGL, and DGL, just to remind you, is the deglycerinated licorice, which doesn't have the risk of blood pressure, and you can get it as a capsule form. They can eat that as like candy if they need to. And it'll increase mucus production by affecting certain prostaglandins. So unlike the marshmallow and slippery elm, which are mucilaginous, licorice doesn't contain mucilage, but rather it stimulates your body to make mucus. So the marshmallow and slippery elm, what you could start off by doing is giving them a small amount of that, and just getting them to have like a teaspoon in a small water bottle, shake it up and sip it as needed. And appreciate even salivating, even just chewing gum, which increases saliva production and kind of gets it to trickle down the throat. Even that can be beneficial for heartburn, just because saliva can help to neutralize some of that acid that's building up. But then adding in these demulcent herbs will have that additional action as well. Now, if you're suspecting that the heartburn is a result of poor digestive function, and you're pretty confident that they don't have a stomach ulcer or H. pylori, then I would give the gentian or other digestive bitters. So what bitters do is they increase the stomach acid and they help to tighten up that lower esophageal sphincter. But because heartburn can be caused by damage to the stomach wall or due to reflux, if you gave digestive bitters to someone who had a stomach ulcer due to, let's say, an infection, you could potentially make it worse. So there's a caution with giving bitters to people with heartburn. So if it's reflux and it's a simple cause, usually giving bitters will make it better. If it's H. pylori infection or drug-induced, then digestive bitters can make it significantly worse. And so that's why I think starting with the demulcents is good. And if they have an aggravation with the bitters, they can use the demulcents and then just stop doing the bitters. Okay. So if I found the person's heartburn, and usually I appreciate if the heartburn was infrequent or irregular, then it's probably less likely to be caused by something like an H. pylori infection. And if they're not taking the medications, obviously that kind of rules it out. But if it's kind of a daily constant thing and they're taking drugs all the time, or if they have it, it's pretty severe every single day, stay away from the bitters. In those cases, I might be moving more towards using an antacid along with some of the other things. And meadowsweet is that classic antacid herb used for heartburn and stomach ulcers. I don't use it a lot, but I do use it in some cases. Crane's bill is a stronger astringent herb. The tannins in these guys, I'm sure, to be honest with you, that herbs like oak and witch hazel probably have an antacid effect as well, because those astringent things just kind of inhibit those proton pumps that make the stomach acid, okay? So meadowsweet, if you were suspecting that they had like a stomach ulcer in there, then I might want to use, let's say, instead of the digestive bitter, I might use, let's say, a tincture with licorice and meadowsweet and chamomile in it would be another thing I might throw in that as well. Now, chamomile has an anti-ulcer effect. I never learned it as being an antacid, but when I was doing a little bit of research on it, it appears to have some antacid effects as well, and some vulnerary properties, which is one of the reasons why it's a good anti-ulcer. Calendula and plantain are also good vulneraries. I don't use plantain as much. Usually I use chamomile and sometimes calendula as the main herbs that I would use for healing like a stomach ulcer, okay? And along with the licorice and even marshmallow. Astringent herbs, again, if it was a pretty significant bleeding going on or like a severe ulceration, then I would use those as well. But generally speaking, I wouldn't typically use astringents on most cases of heartburn, because if it was due to poor digestion, giving strong astringents is going to counteract a lot of the effects of like that you'd want, like a bitter. You want to stimulate digestion, while astringent would kind of neutralize things probably as well, and alter the mucous membranes in a way that may not allow them to function properly, and that's not necessarily good if it's just occasional heartburn. It's good if you're trying to deal with the ulcer. And then finally, antimicrobials. So if you suspected they had H. pylori, then you would want to give them antimicrobials. And the two that I would probably most likely use would be golden seal and myrrh. Golden seal is a digestive bitter. And so if you give that to someone who's got a stomach ulcer, you could make the ulcer worse. And that's why you would want to couple it with things like licorice, and meadowsweet and other things, and chamomile that could counteract some of the potentially acid stimulating properties of the golden seal. So some classic remedies like Robert's formula in the past would include golden seal, like in a powder form, golden seal, slippery elm, marshmallow. Sometimes they put echinacea, sometimes they put crane's bill in it as well. And that would be used for general infections and inflammation of the gut. And so the golden seal coupled with the licorice and slippery elm would reduce the negative side effects that it might have. Is there a way to manage food intolerances to improve digestion? So is there a way to manage the food intolerances? In general, with food intolerances, what I've observed is that you could be born with a predisposition to being sensitive to dairy. And if you eat dairy on a daily basis, like milk, let's say, then what happens is you tend to increase the antibodies you're producing to those foods. If you back off and you don't eat, let's say, dairy for 6 months, those antibodies will come down to some degree, and you may be able to eat it once a week and not have a problem, or once every couple weeks in small amounts, and maybe wine and cheese on a Friday night, and you just have a little bit, you'd be fine. But if you go back to having it a lot, it's probably going to start to aggravate you again. The other thing, though, is that some people, if they have food intolerances, they can be made worse depending on your gut flora, and also depending on whether or not you've had some kind of inflammatory issue going on or other things. So there's a lot of variables in there. So I find people may only have minor food intolerances, and then they got sick due to something and they got pretty severe. And then you're going to have to do some kind of healing in the gut to get things back on track and remove those bugs. So in general, if you're really sensitive to something, you should avoid it. But most people can just minimize it and appreciate that with food sensitivities, it may not be just one food that you're sensitive to that's you have a severe reaction to. It could be a whole bunch of foods that you have a moderate reaction to. So if you have eggs with a cup of coffee that has cream in it, and you have it on an English muffin that has yeast and gluten in it, and you have you know, cheese with it, the egg, cheese, milk, all those combinations causes like a stacked effect. So that might aggravate you. But if you have one egg on yeast-free rye bread with coconut milk in your coffee, and you have a little feta cheese instead of cow cheese, then you might be just fine doing that. So that's kind of what I try to get. I don't like to tell people they can never eat certain things. I get them to modify their diet in a harm reduction approach. But a lot of the time, if they don't like drinking milk and they're drinking it and it's causing them stomachs, they'll gladly give it up. How long does it usually take to heal an ulcer? Depends. You know, it could be it could be it could be days, could be weeks. Depends on if the cause of the ulcer remains. So if you haven't, so you might be able to improve some of the symptoms, but if that H. pylori isn't eradicated, uh, or if the person doesn't stop taking the ibuprofen, or they're on the corticosteroids, or they're drinking a bottle of whiskey a day, then it's going to be a lot harder to heal those ulcers, right? So the turn like in your if you get some kind of cut or scrape in your mouth and your mucous membranes, those tissues repair quite quickly, generally speaking. So if you can remove the causative agent, I don't know. I would think after a couple of weeks that ulcer should be healed. Even days, it's going to be in much better shape. So that's why I'm not opposed to people being on certain acid blocking drugs for a short period of time to heal the ulcer. For after a couple of weeks, it should be healed up pretty good. But like I said, I don't know precisely how many days because it's going to vary depending on the case and the age and the drugs and the cause and everything else. So with heartburn, if it's reflux, I talked about general heartburn. Now I'm going to talk about them in a little bit more detail, the specific types. So again, reflux is due to poor digestive function because they're not eating enough digestive bitters, or spicy food that causes the sphincter to relax, or by overeating, you just aren't able to, the body can't handle the burden on the system. It's like backlog with food to deal with. And so it just goes up instead of going down. Gravity in general, if you eat a lot right before bed and maybe it's spicy food and you're a little bit stressed, then what happens when you lay down at night, that sphincter may just become a little bit more lax, and the acid can just trickles, horizontally. And if you just raise the bed a little bit, that can actually help with a lot of people with reflux at night. But that wouldn't be the only thing. I'd be looking at a lot of the other things as well, including removing excess fat. And I think bad fats like omega-6s, corn oils, and deep fried things is much worse than a little olive oil. Olive oil does have a bit of a bitter component to it, which might be good. And then certain drugs will have that effect on that lower esophageal sphincter. As I mentioned, heartburn, asthma, and chronic dry cough are all symptoms of reflux, but you may not necessarily have any of those symptoms because it could just be silent reflux, where it's just causing erosion, but it's not causing any actual pain. You might also just have a chronic dry cough as your only symptom, and you're just thinking, and the doctors are trying to rule out tuberculosis or some kind of respiratory infection when it's actually digestive. Okay. So for the reflux GERD patients, again, to summarize, avoid the food triggers, increase lower esophageal sphincter tone using digestive bitters, promote digestion using digestive bitters, and some of the habitual behavioral things. Give them something to protect the mucous membrane, some kind of demulcent, whether you give them DGL along with the digestive bitter or you give them powdered slippery elm marshmallow. Respect gravity, and I just mean you might want to raise the bed if they're getting the reflux at night, or if you go and eat a big meal, don't go and like plant yourself horizontally on the couch, right? And then I'll avoid overeating as well. So all those things are important things. Also, you want to avoid taking carminatives too close to bedtime. I almost never get heartburn. I've only had it a couple times in my life. But a few months ago, we had some kind of party we went to, and lots of food, and drank too much, and I had some Zambuca after dinner for some reason, which I never do. And Zambuca basically has anise and fennel in it, so I got overserved, so I had probably a big couple shots of that. I remember in the middle of the night, I guess when I was laying down, I burped in the middle of the night, not realizing it. I just woke up with this horrible acid just burning my esophagus, because those essential oils in the Zambuca basically allowed that sphincter to relax and just came up. So the combination of eating too much and the Zambuca that had those basically was a carminative did not work very well for the GERD. So with GERD, in general, start with your demulcents and your bitters. Okay, I have no problem starting with those two things because you want to promote digestion, but also it never hurts to give them something that's going to help relieve the symptoms that there's an aggravation. Because I don't want to, even if I think it's just the bitter would do the trick along with removing food sensitivities, I would probably give them a demulcent as well, just because you never know what's going to trigger it. And at least then, if they have something that makes them feel better, even if it's not treating the root cause, they're going to have more confidence in you as a practitioner. And ultimately, your goal is to make someone healthy and minimize suffering. And if you can decrease pain without suppressing the symptoms, and that's good. And demulcents are one of the gentlest herbs you can give someone. Like, there's nothing suppressive about it. Unlike an astringent herb, which is pretty suppressive. Like, it's a little bit more suppressive in its action. Yeah. Antacids, you could give it acutely to someone who had reflux, and they could do it as a tea. They could even, to be honest with you, if someone had a heartburn once in a while, if they take Tums, which is just basically calcium carbonate, I think it is, or magnesium carbonate, it just neutralizes the acid. It'll make them feel better. It does impair digestive function. Long term, I don't think that would good. Just like taking any kind of proton pump inhibitor or any of the other antacids, long term would be advisable. But acutely, if these other two things don't work, then I would, that would be an option. And then again, the dietary changes you have to do. Okay, and that's not just removing food sensitivities, but overeating. Don't eat late. Avoid sugar. Avoid the too much spicy stuff. Now, that being said, I've had patients where, because they had, let's say, the one woman had ovarian cancer, and I had her drinking ginger tea to help with the nausea she was getting from chemo. And she was also taking a lot of curcumin or turmeric. She would get reflux from that, even though it was helping with the nausea. She would burp and she'd get a bit of reflux just because too much ginger will do that. And I told her just to take the gentian when she had it. And she found that just taking the gentian acutely when she had the reflux really helped. And I think what all it did was it just gave that message to her, stimulate the bitter receptors, and just told that sphincter to tighten up better. And so I think giving bitters along with carminatives, I can't say this with absolute confidence, but I think it can sometimes negate or minimize that relaxing of the sphincter, or maybe normalize it. Like, it doesn't totally suppress it, just maybe normalizes a little bit to reduce that. Okay. So here's an unusual case where this woman came in. She was a 53-year-old overweight woman, pre-diabetic. She had a cough that was basically all day long. She also had some postnasal drip. I suspected she had GERD, and that the GERD was responsible for both the chronic cough and the postnasal drip. Also, because she was overweight, appreciate you just have more pressure on the stomach, just kind of squeezing it, forcing that stomach contents to come up. So with her, my treatment was I gave her basically gentian, 5 to 30 drops before meals, and then I made her a little tea that had marshmallow and licorice in it. So a little bit more of the marshmallow, a little bit of licorice in there, 4-to-1 ratio, and she could just drink that as needed for the heartburn, and then got her to remove the red flag foods. And then basically, this is after, I think it's 2 weeks. Yeah, 2 weeks. So you can see her chronic cough and her postnasal drip in a 2-week period alone. She basically went from being like a 9 out of 10 down to a 2 out of 10 and an 8 out of 10 down to a 4 out of 10. And she's even doing better now, frankly. I just haven't updated this. So with this, here are 2 causes of reflux that you wouldn't necessarily attribute to digestion, but that's what it was. So she's doing great. Or maybe it's the food sensitivities. Who knows why? So, and she only took the tea as needed. She wasn't doing it on a daily basis. So it's mostly the bitters and removing the food sensitivities. Now, for gastritis and ulcers, this is more serious than reflux because there's damage to the stomach and potentially ulcers that are being formed. Most of the time, it could just be heartburn. If it's due to an infection like H. pylori, you might have bad breath with it. The fullness, burping, nausea, that can all be related to indigestion. So those aren't really distinctive symptoms. Bleeding is probably one of the more serious things. So if someone has really dark stool or if they're actually vomiting what looks like coffee grinds, those are symptoms that they have a bleeding ulcer, and you don't want to mess around with that. A lot of time they could have internal bleeding that's sort of they're not aware of, and they could have what's called occult blood, and they can actually do a little test for that, stool test for that, to rule that out as well. But if someone has chronic heartburn and they had really low iron levels, I might think they have some kind of ulcer. So again, infection, drugs, stress are the big ones. Remove the cause. In this case, I really want to bring down that stomach acid, whether they use a drug or whether they use herbs. You want to get that down as quickly as possible, protect the mucous membrane, speed up the healing. So it's a slightly different strategy. Now, a lot of people, if I suspect they have H. pylori, I might just recommend they go on the round of what's called triple or quadruple therapy, where they go on a couple of rounds of antibiotics with demulcents and antacids, or not demulcents, with antacids, and they usually give them Pepto-Bismol as well. It works most of the time. It's covered by health plans. And if it works, why not use that? Now, I usually wouldn't necessarily be the first line therapy, in my opinion, for people with H. pylori stomach ulcer. But I have had people come in where they've gone on the drugs, and maybe they were resistant to it or whatever it was, and then they said, well, I have this, I did try the drugs, it didn't seem to work, and then I'm still positive for H. pylori, and I've used herbs, and I've been able to clear it with the herbs, but I don't know which one's more effective, okay? So with this, I still want to remove some food sensitivities, eradicate an H. pylori infection, and that's where I might use things like golden seal myrrh, along with some things to protect the mucus lining, like give them some licorice in that, or some DGL, add some meadowsweet in the formula, and then throw in some chamomile, whether it's a tea or in a tincture form, to help act as a vulnerary, okay? So the demulcents, we went through that. Licorice, DGL, marshmallow, slippery elm, antacids, meadowsweet, cranesbill. Also, just as an aside, chamomile, I think, is a bit of an antacid as well. Your anti-ulcers and vulneraries, that would be chamomiles, would be my main one. Plantain and calendula would be okay. Astringents, more if there's depending on the severity, I might throw those in as well. Meadowsweet does have some astringencies to it, but won't be as strong as the cranesbill and the oak. And then antimicrobials, golden seal and myrrh. I saw a question that come up here. Can you explain how banana or eggs can worsen GERD? I think what I've seen with people who have an egg intolerance or sensitivity, when they eat them, I think it just slows down, delays emptying of the stomach, because that's the reaction that they have to it. So I know some people, if they eat eggs for breakfast, they just don't feel like eating lunch, and they might even skip dinner just because they feel heavy and bloated and nauseous after eating it, and it just slows down digestive function for some reason. And so heartburn and constipation is often associated with just some kind of immune reaction the person's having. I don't understand the precise mechanism, but I see it all the time with eggs causing aggravating GERD and constipation. Banana, again, I don't know what the precise mechanism would be with that. Green bananas they do have some astringent compounds. Maybe they inactivate some stomach acid because of the tannin content, or maybe it's a food intolerance. It just sort of makes the food sit there as well. So I don't know the precise mechanism, okay? Do you feel that you have to give a lot of support and help for elimination diets? Yep. I can imagine a 50-year-old woman eliminating eggs, wheat, yeast, sugar, and dairy. I wouldn't find it very easy. How do you go about doing it? I do it every single day. So that's why I give them a list. If you want, I'll post up the little handout that I give patients. I should update it and change a few things on it, but it's a good start for most people. And I make sure that if I'm telling them to not eat yeast, so saying don't eat yeast. So here's the type of bread you can get and where you can get it. If you want to drink booze, don't drink beer, but you can have these types of things. So I give them options just to exchange them. And although it can be challenging, I just say it's only for a 2-week period to see how you do. And then if you want to eat eggs after that, you can go ahead and eat eggs. If it doesn't bug you, if it bugs you and you want to eat eggs. But maybe you have to eat them less frequently, or maybe maybe eat them less frequently, or maybe you just are going to suffer and you're happy doing that. That's their choice. So who's this? AB, gastritis case. So here I had a 45-year-old woman. I asked her if she had a stomach ulcer. She said no. She had chronic heartburn, lots of pain in the epigastric region. She also had sore throat, so it sounded like she had reflux going on as worse. Seemed to get worse when she ate a lot of sweet things. Better with Gaviscon. Gaviscon's kind of like an over-the-counter medication that contains algae, so it acts as like a demulcent with some. I think there's aluminum hydroxide or one of the other antacids that are in it, and neutralizes stomach acid and has a demulcent effect. I thought she had GERD only. I didn't actually think she had H. pylori. Turned out after that, when I asked her, do you have a stomach ulcer? She said no. I said, oh, okay. After I found out, I said, okay, you don't have a stomach ulcer. Do you have H. pylori? She said yes, but she didn't volunteer that information to me. So I started off giving her gentian. I also gave her DGL. So when I first gave gentian, actually, this is students when I was working. I'm going to blame the students, not myself. This is when I was supervising at Parkdale. The students gave them gentian because we all thought she had heartburn. It got worse after the first week. And so we stopped the gentian, and then we gave her chamomile, marshmallow, probiotics. And I guess actually we did give her DGL the first visit, but she never picked it up. So even though we gave her gentian and DGL, she was only doing one of them, and she got worse. And she wasn't compliant after that. She didn't do anything that we told her to do. I mean, she stopped the bitters. But I think what we did in this case is we caused an aggravation with the gentian. And because she wasn't taking the demulcents along with it or the other things that we recommended, she just kept getting worse. So here's the case where, her symptoms did get better and worse depending on what she was doing. But I think we kind of aggravated it, made things worse. She wasn't paying attention, and then she just stopped coming in. And you know what? Fair enough. So the reason why this is a case like 10 years ago, and I think it's also worth mentioning there are cases where you can cause people to get worse. And here's one of my little failures. So you can learn from my failure to appreciate that, yes, giving digestive bitters can aggravate heartburn. But in most cases, it doesn't do this except for the patient had H. pylori. The two things I learned is bitters can aggravate some cases of heartburn, and two, just because someone says they don't have a stomach ulcer doesn't mean they have H. pylori. So you got to make sure you ask the right questions, okay? I think we should probably take a little break here. Yep. So let's take an 8-minute break and come back at 10:50. And if you have any questions, then please write them down. I'll answer them when we get back, okay? Yeah, I'll be back shortly. I have a question here. Christine's asking, is this how we dose for GERD? So we would give a bitter like gentian a few minutes before each meal and a demulcent like marshmallow to sip on 1 teaspoon with water or as a tea throughout the day until symptoms improve. Yeah, that's how I normally do it. Give a bitter before meals if you can, and if they forget it, they can take it afterwards. Um, and then the marshmallow and the slippery elm. If they don't have any symptoms, I probably wouldn't necessarily get them to take it. But if they had symptoms, they could do that. Um, Usually, when people have intermittent symptoms, so like they might have heartburn a few times a week that lasts for like an hour or so, or 2 hours. There's other things you can do as well, but yeah, that's more or less how I do it. So I should be able to cover more slides in the next hour than in the first hour, just because the information is a little bit different. So bloating and gas is just a symptom that people frequently get. That's usually diet related. And so I would say that for people who have the occasional symptoms of bloating and gas, it could be related to some type of food intolerance in general, okay? Now, appreciate that if you eat too much sugar in general, what'll happen is, like kids around Halloween time, they'll get a tummy ache, they'll get all bloated and distended and get gassy. And that's just because you eat too much sugar. You're not going to absorb all of it. It's going to go into your intestines and get fermented by some of the bacteria there and just basically cause gas buildup and bloating, and can also lead to cramping pains associated with the gas. Now, also, if you just eat certain types of fiber, like if you eat a lot of refried kidney beans, everyone's going to produce some gas if you're eating kidney beans, just because we don't digest it and the gut flora will. Also, lactose intolerance. So if you can't break down the sugars in milk, then they will travel into your intestines. And one, the lactose, a bit of an osmotic laxative sometimes, depending on the dose. And two, it'll just generate sort of discomfort by creating this bloating and gas. So this is usually when I say gas, I'm referring to flatulence. Now, some people, if they have certain bugs living in the gut, and it could be something like your normal gut flora just will ferment fibers and sugar, or maybe like a yeast overgrowth. So there's too much candida in the system that just when you eat any kind of sugar or fruits, it causes that bloating symptoms. Or even the more severe cases, giardia, which is causes a lot of gas, also associated with diarrhea. That can be an issue. In addition to the high fiber diet, I should have included the prebiotics up with the high fiber diet, because I would say fiber in general acts as a prebiotic, and a prebiotic is a substance that feeds the probiotics, the good bacteria. So prebiotics are usually indigestible fibers. If you look under the label of certain foods, they'll contain like inulin, and they'll use that as a thickening agent for certain foods. Some people, when they consume inulin, it just makes them gas and makes them feel bloated and gassy and not well. FOS, fructooligosaccharides, are foods for your gut bacteria, but they can make some people feel awful. And you'll find some probiotic supplements will contain those. And also chicory, just chicory root contains inulin, and that's sometimes an additive in some of the health food stuff that can just make people very gassy. So those above causes are usually associated with normal bowel movements or regularly normal bowel movements. Sometimes people will come in and they'll say, I just have a lot of bloating and gas. And you ask, and you say, well, do you have a bowel movement every day? And they say, yeah. But what I always follow up with, say, well, do you feel like you fully evacuate the bowels? Like, is everything coming out? Because it could just have a backlog where, the bowel movement they're having today may be the one that was produced 2 days ago. So everything's moving. It's just moving too slow in the gut and giving more time for things to ferment. And so, generally speaking, both constipation, people think that they're having a bowel movement every day, they're not constipated, but that's not optimal bowel function if they're not fully evacuating the bowel. So if there's any kind of straining or if they don't feel like everything's coming out, it's not going to feel well. And I would say, like, one of the things that I've noticed when I travel and is that you often, our bodies have certain times where we like to go to the washroom. And due to travel or some unusual change in your schedule, you might miss that 9 a.m. bowel movement or 8 a.m. bowel movement that you normally have. And even just missing it by 6 hours can make you feel bloated and gassy. So even if you have it later on in the day, that can still make you feel worse. So appreciate treating bloating and gas is going to be looking at what's going on in the bowels in general. And then finally, atonic digestion. If you're not breaking down the food optimally, that's going to lead to bloating and gas. So you have to kind of put on your thinking cap and think, well, is this due to sluggish bowels? Is this due to the fact that they're consuming too much sugar and junk food? Or is it that they're really healthy, but they're just eating a lot of fiber that could be aggravating them? Could there be bugs going on? So lots of different causes. So first thing you want to do is remove food triggers. Stimulate digestion could be an option by giving them like a digestive bitter, supplementing with digestive enzymes. So something like Beano is I think it's beta-gluconidase, I can't remember what the enzyme is called. Anyways, it's the enzyme that breaks down the fiber that's in beta-glucoxidase. It's the enzyme that's in that breaks down the fiber that you get in most beans and a lot of vegetarian-based diets. So sometimes with vegetarians, they're eating healthy foods, but it just produces gas. I might recommend they supplement with one of those enzymes because they may not have a lot of options for, if legumes is a big part of their diet for getting protein, then they may just supplement with an enzyme and everything's problem solved. If I suspect they have sluggish bowels, then I might want to promote a bowel movement either by increasing fiber, which could make the bloating worse, but depending on the type of fiber, it could make it better as well. I might give them a osmotic laxative like magnesium to kind of get the bowels working a little bit better. Also help them expel gas. So this is where the carminatives are particularly useful because they can relax the sphincters to help get the gas that's trapped in the system to be released. If they get a lot of cramping pains, then you might go with the antispasmodic herbs. And some of the carminatives will have antispasmodic effects like peppermint and chamomile. And then there are stronger ones you could use like greater celandine or celandine. I think is a little bit stronger than peppermint. It's not a carminative, but it can help. And then in some cases, you may have to improve the gut flora. And so if they had like what's called dysbiosis or some kind of disruption in the gut flora, they get a stool sample done, it comes back negative, I still might give a round of antimicrobials for a couple weeks to see if there's an improvement. Usually I'll see an improvement after a week or two. And that might be another area that you explore for dealing with the bloating and gas. But I won't start there. First thing I start with is removing the food triggers. Next thing I would look at is stimulating digestion and ensuring the bowel movements are good. One other thing is probiotics are great because not only do they help with the gut flora, but they can also help promote bowel movements. So you're kind of hitting, and they also help supplement with some enzymes as well. So they can help a lot. So a lot of these cases, I would probably give probiotics along with it. So carminatives would be sort of the thing that you would give acutely if someone felt bloated and gassy. So the simplest thing is say, go grab yourself a cup of peppermint and chamomile tea. You can get essential oils encapsulated. They're also useful. So that might be something. So acutely, your carminatives would be the way to go. Okay. Long term, if you're thinking it's a sluggish bowels, I might get them to eat, and they don't have a lot of fiber in their diet, and they don't eat a lot of fruits and vegetables and things like that. I would probably get them to recommend the breakfast I usually get people to have, and that's basically what I call the healthy breakfast, where I have a cup and a half of fruit with 3 tablespoons of a combination of flax, chia, and hemp in it. And so 1 tablespoon of each basically, and then throw some walnuts in it with lots of water in. And so by drinking more water, you hydrate the stool, and by taking the fiber in that form for breakfast, you're helping to bulk up the stool and promote more regular bowel movements. So both of those things are pretty good, and they may not need anything else. If I'm thinking they also have some symptoms of indigestion, I might give a bitter with that as well. Bitters can help, but it may not be something I do with everyone. And the antimicrobials, if I suspected they might have some dysbiosis, because after removing food intolerances and getting them to have better bowel movements and promoting digestion, if I still suspect, and I maybe gave a digestive enzyme as well, and I still didn't see improvement, and I was suspecting kind of a yeast infection or some other kind of bug, then I would give antimicrobials along with probiotics. So colic is just basically cramping of smooth muscles, and you can have that in your digestive tract, in your gallbladder. So in your gallbladder, it's called biliary colic. In your intestinal tract, it's usually just called colic. You can also get renal colic, so in smooth muscles of the urinary tract. So it's just basically spasming of smooth muscles. And this is often associated with things like food intolerances or chronic constipation, or if there's gas getting trapped inside. And so in babies, they'll say, oh, that child, they're a colicky child. And it's almost like colic has been associated with just a fussy baby. But in my opinion, if you've got a lot of bloating and gas and cramping pains, you're going to be pretty fussy too. So I think it's kind of dismissive that in the past they just say the baby was colicky. But meanwhile, they probably had a lot of food sensitivities that were undiagnosed, or they're put on. I remember, well, there's a lot of kids that are thrown on, let's say, formula that's milk-based, and they have a milk intolerance, and they're miserable. And, you know, if what you're eating all the time is making you sick, you're going to be crying and fussy and very difficult to console. So the main risk factors here would be your food sensitivities, also just excess fats and sugars. Constipation can cause it, poor digestion, infections, all those various things. But with kids, it's almost always a food intolerance. Okay. So the simplest thing you do is identify and remove that food intolerance. Most of the time, is eggs and milk are the two big ones, but it can be other things. Reduce your sugar, promote bowel movements. So in a kid, it might just be giving them probiotics. Now, probiotics usually help prevent colic and improve digestive function and constipation in kids. My daughter gets them every single day. For some reason, my son is sensitive to them, and when we first started using, he'd always kind of get a bit complaining whenever, like not right away, but hours later, he's a little bit fussier. So I don't know, he's a little bit more difficult. So we're not actually supplementing with him, even though most patients, the kids do much better on it. So I got one of them that might be exception to that. Relieving the bloating and cramping is just like what we described before with your carminatives. And then improving the gut flora, again, goes along with probiotics for most kids. Most young kids aren't going to have issues. And good question came up from Daniela. For babies, are you removing the food from the breastfeeding mom? Are you referring to the milk tolerance, meaning that even breast milk? So usually with moms that are breastfeeding, if the kid is colicky, you're not like, if the kid's only drinking breast milk and the kid is colicky, then it's something that the mom is drinking or eating that's disrupting the baby. And so to give you an example, my wife, when she was nursing our daughter, if she had a spoonful of cow's milk in her Tim Hortons tea when she went out for a walk, that was enough to cause colic in our child, and she wouldn't have a bowel movement for one day. And we know she has a milk intolerance, and so we avoided it for months. And then on her first birthday, she got some ice cream because we thought, well, we'll give it a try and see what happens, because sometimes they will grow out of it. But she ended up vomiting and getting all this regurg in the middle of the night. She's like, help, help. And then we go rushing in, and she'd vomited in her crib. And so she can't do milk at all. And she knows she can't do it. So we have to do coconut-based ice creams and all these other things. She can eat cheese as much as she wants. She just cannot do milk, sour cream, or the whey component in the milk as well. Okay. So we have to, when a infant who's nursing has colic and you suspect it has food sensitivities, then you have to go back to and look at what the mother's eating, because the mother might be okay with that small amount of milk, but maybe the baby isn't. And again, it's the same things. Milk, eggs are usually the top big ones. Okay. So elimination diet, and then carminatives, like I said, I've used the Fisherman's Friends ground up in coconut oil. Give a little spoonful of that, or taking essential oils. You could add them directly to the coconut oil, or you could use a little bit of chamomile and peppermint tea. And chamomile and peppermint and fennel and these things, they're pretty safe, so I'm not really worried too much. So another thing, not all babies have milk intolerance, but they have colic pain. Is there any herbal medicine that we can prescribe for babies? Again, it would be, there's something called gripe water that is made with a number of herbs rich in essential oils. You can find that, even pharmacies have that. But that's basically using like your fennel, anise, and chamomile. If a child doesn't have the milk intolerance, they probably have another type of food intolerance you have to identify. So it would be very rare for a kid to have colic that didn't have some kind of digestive issue. I mean, I guess if a kid was teething, they might be fussy and the parents might call them colicky, but it may not be colic per se. It could just be a tooth coming in. But by default, kids should be happy until they're hungry, or if they're tired, they're going to cry. So normal, healthy children are probably only going to cry if they're tired or they're hungry, or they got a dirty diaper, things like that. And if they're crying for no good reason, there's probably a good reason why they're crying. Okay, and you just got to figure out what that is. And it obviously it may not be a food intolerance. Maybe there's something more serious going on, but you want to figure that out for sure. And it may just be that you haven't removed that food. And again, I've had people where they don't react to milk, but it's like rice is the thing. And those are the tricky ones. So constipation. So constipation just means you're not having enough bowel movements. Some medical doctors' definitions might be not having a bowel movement for like 5 days or 6 days. It seems awfully long. Like, as far as I'm concerned, if I don't have a bowel movement, pretty much at least one a day, I'm not feeling great. So usually multiple bowel movements is sort of ideal. 1 or 2 bowel movements a day is probably good. Some people think even more is better. That might be the case as long as it's not loose stools and diarrhea. If you eat lots of fiber and fruits and vegetables, you're going to have more than if you're eating lots of hamburgers, So the primary cause of people with with constipation, that assuming they're drinking enough water and they're exercising and they have enough fiber in their diet and all those things, the most common cause would be food sensitivities. Okay, so this is just kind of an extension of, if they were a colicky kid, they probably have sluggish bowels and constipation when they get older. So that would be the first thing I'd want to rule out. Another thing that can occur, though, is if people have the overgrowth of certain bacteria that are methane producing. So it can either be SIBO or dysbiosis, where they have a lot of certain bacteria like the Methanobrevibacter smithii bacteria. That's just one particular bacteria that makes a lot of methane gas. Those bugs, when the methane gas gets released, it slows down the transit time. And so I've had cases of people where I do all the food sensitivities, fiber, probiotic, all the things that should work, and their bowels are still sluggish. And the only way they have a bowel movement is by taking magnesium citrate every day. And I'm like, well, that doesn't seem normal. And in that group of people, I'll give them, I've done a breath test on them that measures methane gas production. I don't like doing it because it's almost $300. But with one person that I was seeing this year, we did a breath test and she was off the chart for her methane producing bacteria. And so we basically gave her antimicrobials, killed it off with a bunch of things, and she's getting a lot less of the burping now, which is another one of the symptoms, and her constipation is pretty much resolved. So, and then drugs and just sedentary lifestyle, again, will contribute to constipation. So what do? Remove food sensitivities, promote digestions, You might want to give a bulking agent. So if you did the healthy breakfast I usually do with the tablespoon of flax and chia and hemp and fruit, that often is enough fiber. You could also supplement with psyllium or other types of fiber supplements as well. I might consider using a laxative. I usually use osmotic laxatives like magnesium before jumping to senna or castor oil, but they would be indicated as well under certain situations. Also, if they have constipation, they'll often get a lot of cramping pain. So normalizing peristalsis would be using carminatives, and some of the bitter herbs can help with that as well. You might have to kill off some bugs that are messing things up. So give a bunch of antimicrobials with probiotics can help, and then relieving the bloating just with carminatives as well can help. Now, for it to say, appreciate bloating can be caused by other things. Another cause of bloating, in addition to digestive issues, is like ovarian cancer. So something to think about. If someone feels bloated and they're not getting better, it could also be related to something with the uterus, a fibroid, uterine cancer, things like that. So female complaints could be the cause of bloating in addition to that. So someone may not be constipated and they think they are with this bloating, and it could just be like a something related to their ovaries or their uterus. Okay. And here's just a little study. Irritable bowel syndrome, particularly related to the constipation predominant form, involves an increase in these methane-producing bacteria. Okay, and so that was something that I sort of something worth remembering for those really stubborn cases of constipation that don't respond the normal ways. You may have a bug. So with acute constipation, what do? Stimulate the bowel movement, normalize peristalsis, meaning give them something that's going to reduce the cramping, and then relieve bloating. So the easiest thing to do for most people, I usually just give them magnesium citrate or magnesium bisglycinate is great. It's gentle, easy to control the dose. If they have a powdered magnesium citrate, they can just go from a half a teaspoon to up to a teaspoon if they think they need it. Most people are deficient in magnesium. It's not habit forming, it's calming. So it's not a herb, but I use it all the time. It's my go-to laxative. In some cases, I'll use a stimulating laxative. Senna, buckthorn, aloe resin are all options. Usually just use senna. Castor oil, very rare that I use it. Where I might use it is if I was trying to just purge out the intestinal tract, for something being someone who has some issues and I just want to kind of get things purged out, or I thought there was a bug or some other things, I might use it, but it's so rare that I don't remember the last time I've used that. Okay. And then if someone has acute constipation, it's worth telling them about the carminatives, because sometimes if they take a stimulating laxative or even really high dose of osmotic laxatives, they'll get cramping and bloating and sometimes gas with it. And so having some fennel or caraway or a little peppermint tea can really help improve the symptoms. That often is kind of goes along with being acutely constipated, and also goes along with giving a laxative that can sometimes get the bowels moving, promotes the movement of the bowels, which if there's some stool obstructing things a little bit, that can also lead to cramping pains. Okay. Now with the sluggish bowels, which is more of a kind of a chronic constipation, this is where you're looking at focusing on doing more of the removing the food sensitivities, promoting digestion, bulking agents, maybe consider doing an osmotic laxative on a daily basis at night, normalizing the peristalsis, giving a probiotic to help with the gut flora, or giving antimicrobials, and then relieving bloating. So it's kind of repetition of one of the other slides. Bulk laxatives, psyllium seed husk is the main ingredient of Metamucil, over-the-counter fiber supplement used to promote regularity. Flaxseed and chia are often used in people's diet. Even slippery elm. I find sometimes I'll recommend that for people that are sensitive to the above two. So psyllium might be too gas forming for someone, or flaxseed, they may have a sensitivity. I've used slippery elm, especially if I think there's some inflammation along with it. Aloe gel, marshmallow, I don't use them very often, but you could. Then you've got your digestive bitters that indirectly will help promote the release of bile that can help with bowel movements. So gentian, chicory, and barberry, wormwood, all these bitters. You got your carminatives that can help with the acute cramping pains that may come up. You could just, even though they might be doing pretty good, you might give them osmotic laxatives. So I wrote a little blog article on different types of laxatives you can read. I provided a link last week for some useful little readings. Magnesium is what I use, but things like kiwi, prunes, vitamin C. So the way that prune juice works is it basically acts as an osmotic laxative because the sorbitol, the sugar in it, is an alcohol sugar that's not absorbed. And so when it's not absorbed, it remains in the lumen of the bowel and then pulls water into the bowel. So that's why prune juice, which if you've ever seen it, it's not viscous. It's not thick and slimy like most fiber sources is. So it's not the fiber that's doing it. It's the sorbitol that has that laxative effect. Consuming any amount of oil in high amounts, olive oil, flaxseed oil, mineral oils, even fish oil supplements, there's a certain point where if you don't absorb the oil, it'll remain in the stool and kind of lubricate it and bulk it up. So that's how stool softeners work. So even just taking a little more olive oil and flaxseed in your diet might have a positive effect. And then your antimicrobials depends on what you think's going on there. So on the other end of the spectrum, we've got diarrhea. So diarrhea basically means you're going to have watery stools that are either totally loose or liquid, and it typically involves a certain degree of urgency and often cramping pain if it's severe enough. And I think everyone has experienced diarrhea at some point in their life, but if you're getting it on a chronic basis, then you got to figure out what's bugging you. The reason why your body produces diarrhea is something's irritating the intestinal tract. And the way your body responds to an irritation of the intestines is it basically pumps more water into the area to try to dilute it, and then it increases peristalsis to try to flush it out. So diarrhea is a natural, healthy way for the body to purge out some offending agent. And one of the most common causes of chronic diarrhea would be a food sensitivity. So somebody who eats an egg could get constipation and reflux where it slows things from descending and they kind of go up a bit. And in other people, it just causes the opposite. It just causes like urgency and diarrhea. So removing that's important. Consuming too much sugar in general that your body can't absorb, whether that's eating a lot of candy or whether that's drinking milk that has milk sugars that you can't absorb, will also produce diarrhea if you consume enough. So at some point, if you just drink like 3 or 4 pops and your body's not used to it, it's going to probably cause a little bit of loose stools and diarrhea. Kids around Halloween could get some diarrhea. Some people can absorb it, all other people can't. It's also important to rule out certain infections. So there are various bugs that can cause it. Some of them are bacteria, like E. coli is one of the most common causes of traveler's diarrhea. And even though you have E. coli in your gut, it's the strain in that particular area that could, you might not be used to. And if you hang around long enough in that area, you're going to develop antibodies that will probably bind to the toxins, that the enterotoxins produced by it. But more serious things are like parasites, like Giardia and cholera can cause it. And in some people, yeast, if they have like yeast infections, they got, even though yeast isn't normally a bug that causes diarrhea, like it doesn't, to the best of my knowledge, produce an enterotoxin that causes diarrhea. But I think what happens is some people, they have yeast overgrowth in the gut and their body has mounts an immune response to that, and those antibodies, when they bind to the yeast particles, causes the irritation to the gastrointestinal tract, like a food sensitivity, and that promotes the diarrhea. So it could be that it's not the bug itself that's directly causing it, but indirectly creating an immune reaction that irritates the bowels. Now, more severe causes are inflammatory bowel disease, and these conditions are a lot trickier. Crohn's disease, I think, is one of the harder things to treat. And there's certainly some improvements you can get by dietary changes and a whole bunch of different things. Colitis, ulcerative colitis, I've had cases where I identify and remove a food intolerance and the person's cured. And I've had a case I saw recently. I tried everything with this guy and I can't get him better. And he's totally stumped me. That doesn't happen very often, but it does happen. Actually, and frankly, the doctors can't figure it out either. Drugs and stress, those things can affect it as well. So, how do you treat diarrhea? If it's a chronic thing, then it's more likely to be a food sensitivity. If it's an acute thing that they just developed ever since they came back from Cuba or India or wherever it is, it's probably going to be an infectious cause, or if they took a round of antibiotics and it came. So they may have chronic food sensitivities that are low grade but have become worse after getting some kind of bug in the gut. So depending on what's going on, removing food sensitivities might be the first thing I do if it's a chronic thing and they're eating eggs and milk and all those things. Or if they just came back from a trip, I might start by eradicating an infection and supplementing with probiotics. Those things are both good things to do if it's more of a traveler's diarrhea, okay? There are some anti-inflammatory herbs that can be beneficial. There's a study I was reading that showed wormwood, which has anti-inflammatory properties, appears to help people with Crohn's disease remain in remission longer. So I might give wormwood chronically to someone with Crohn's disease, or turmeric or curcumin may have a positive effect on colitis and Crohn's. And so although those aren't the first things I would do if someone came in with like an infectious diarrhea or chronic diarrhea that I thought was related to food sensitivities, that might be something for more severe situations, okay? Now, if they're having a bowel movement several times a day, appreciate hydration is the single most important thing if they're losing a lot of water. And if they start becoming dehydrated, you can die from cholera or from Giardia or from infectious diarrhea. It's one of the biggest leading causes of death worldwide in children, right? So hydration with water and oral rehydration solutions is vital, okay? With some types of diarrhea, you're going to get a lot of cramping pain. And this is where some of the antispasmodic or carminative herbs can really alleviate some of the discomfort. And if you normalize or kind of reduce the cramping, it's also going to reduce the urgency. And you're not suppressing it per se, but things like chamomile tea, for example, it's often used for diarrhea in children because it has an antispasmodic effect, and it appears to have an anti-secretory effect that alters those transporters that pump the sodium actively into the bowels that leads to the diarrhea. Now, in some cases, you could have very severe diarrhea where there's like a lot of bleeding, like hemorrhagic diarrhea due to certain types of E. coli or dysentery and things like that. So if you had severe bleeding, you might want to throw a tannin into the mix as well. So the simplest thing you can do for acute for diarrhea in general would be to give a bulk laxative. And I've explained this before. If I hold out my hand and I pour water into my hand, it'll slip through my fingers. If I pour a big bowl of Jell-O into my hand, I can grip the Jell-O much better than I can grip water. And that's because of the fiber content in that. So psyllium is a great herb that's a bulk laxative that acts, that gives more volume to the stool, but also makes it so that your bowels can hold on to it better. And so taking psyllium may reduce going to the bathroom, let's say 20 times a day, could reduce it down to 10 times a day, or 10 times a day down to 5 times a day. And it gives you better bowel control, reduces the risk of dehydration because you're decreasing that transit time, which is important. So it's not suppressive, it just reduces, it slows, it moderates, it modulates, okay? Flaxseed also can do that, so can cyprium. Personally, I've used psyllium when I had a bad Giardia infection until I could get on the medications to kill the Giardia, and it worked wonders, okay? Marshmallow, allogel, to a lesser degree, those wouldn't be my first choice ones. Herbs that are known to have an antidiarrheal property are things like golden seal, psyllium, and chamomile, and they do this by different mechanisms. Golden seal, the berberine, and some of the other compounds have an antimicrobial effect, but they also seem to they have an anti-secretory effect as well. It affects some of those transporters that are involved with pumping the sodium, which causes the water to go into lumen of the bowel. Psyllium also seems to have an anti-secretory effect, so it may have benefits beyond just the bulk laxative effect that it has. Okay, and chamomile as well appears that maybe through its antispasmodic effects, maybe through its essential oils by normalizing, maybe some of the other compounds have an anti-secretory effect. So they kind of work by different mechanisms. So depending on what you're looking for, you might choose one of these herbs over the other. If it's a kid, maybe a little bit of psyllium and chamomile might do the trick. If someone has traveler's diarrhea, you might give the psyllium alone and then make a tincture with some of these other things. Now, astringents, like I mentioned, can arrest the bleeding. Witch hazel, oak, bilberry is one used for infantile diarrhea. It's very gentle. So for a kid with diarrhea, I might use chamomile with bilberry and a little bit of psyllium, for example. And that might help with some probiotics. Antimicrobials, if it was infectious, I would probably be looking at doing things like golden seal, myrrh, podarco, wormwood, any of those in combination probably would be beneficial. Golden seal is always my go-to for GI infections and stuff. I don't usually use barberry and Oregon grape. They're similar, but they're not as good in my opinion. Myrrh I usually throw in the mix as well because it works for parasites as well. Podarco I sometimes use. And then your anti-inflammatories, there's a whole bunch of different ones, but I mentioned wormwood and turmeric because there's a few studies with those. So IBS, all that your IBS is basically something wrong with the bowels. And there are different causes of it. So there's IBS-D, which is mostly diarrhea, or IBS-C, which is mostly constipation. Or there's IBS-A, where there's basically it's alternating between the diarrhea and the constipation, or IBS-P, where it's pain predominant. So those are the different ones, and it could be variations of those. Basically, I think medical doctors are under the impression there's no known cause, and I would say that this is something that I treat all the time. My practice is based, this is probably one of the most common things I treat, and it's, in most cases, it's pretty easy to get, maybe not full resolution. Some people it would be, but certainly it's easy to identify, or you can identify the food intolerances. That's one of the primary causes. So it's usually food and the gut flora. So there could be dysbiosis, meaning there's just the wrong types of bugs living there. And some of that could be due to a frank infection, like Giardia, because it came back from India and they had always had IBS since. Or it could be maybe there's too much yeast in the gut, or maybe just the wrong ratios because they've been eating a lot of processed garbage and not enough fruits and vegetables. It just led to, a whole bunch of bugs that are not supposed to be there. And then stress is usually not the cause of IBS, but it makes it worse, okay? So some people are more of a food sensitivity due to the IBS, and that's usually if they've said, oh, I've always had like a delicate stomach, then I'm going with food intolerances first. If they came back from a trip and they've had IBS, they've been diagnosed with IBS, or if they went on antibiotics and now they've got IBS, or they also have a history of chronic yeast infection, vaginal yeast infections, then I'm going more towards like an infectious dysbiosis cause. So again, food sensitivities, eradicate the infections, improve digestion. So if you can stimulate digestion functions so they break the food down better, then they may have less food sensitivities because partially digested foods are more likely to be reactive than ones that are broken down effectively. So if people are overeating and they have sluggish digestion, maybe that's going to be more of an issue for them than if they eat smaller meals and fully break the food down into particles that are less likely to irritate them. In any kind of IBS, increasing fiber content in the diet will help with both the diarrhea or the constipation in most cases. So bulking up the stool is a really useful thing to do. And that may be just by, with the breakfast I mentioned, with the chia, the flax, the hemp, and the fruit, that has a good bulking agent and that can help. Or maybe they have to take a psyllium. Reducing the urgency, again, that can be related to the fiber, could be using some carminatives, decreasing pain. Certainly the carminatives, essential oils, and antispasmodic herbs can be useful for that. And then finally, managing stress, however you might end up doing that in practice. Someone's asking, how do you give myrrh as essential oil? No, myrrh is usually as a tincture form. Tincture form. So elimination diet, bulk laxative, carminatives, antimicrobials, bitters. We've already gone through that. So here's a person, or candida. So one of the things that we also treat in practice is candidiasis. And so candida is a yeast that is naturally occurring in our bodies. And women get vaginal yeast infections. Strangely, men never get vaginal yeast infections, but they can still have the yeast living in their guts, and so can women. So I think what happens when women have chronic vaginal yeast infections is they harbor the yeast in the intestines, and under certain circumstances, that yeast will migrate into the vaginal area. And so to treat chronic vaginal yeast infections, you have to work on the gut, okay? So there's diet and lifestyle factors that can predispose you to getting it. So you want to reduce the amount of sugar, give them some recommendations on not wiping from back to front when they go to the washroom, but going from front to back. I would also, from a diet standpoint, get them to avoid dietary yeast. So yeast in bread and beer, get them to avoid that. If they're on antibiotics, that can be an issue for them, or if they're on immunosuppressant drugs like corticosteroids, that can predispose them. Hormones and estrogen seems to be a factor. So often the symptoms that people might get can be similar to other GI conditions. Bloating, gas, cramping, diarrhea. Sometimes you'll see that if they have a sensitivity, it could be a skin issue like hives, or eczema can be aggravated. They eat bread and beer or sugar. They may have itchiness in the vaginal area or the rectum, topical hives, fatigue, sugar cravings, anxiety and depression, lots of different things. So what do? Eradicate the infection, improve the gut flora, stimulate the immune system, reduce sugar, which feeds the yeast, avoid dietary yeast. And in this case, there could be a cross-reactivity where when you have yeast living in your gut, antibodies are formed against those yeast, and then you eat bread that has yeast in it, then those same antibodies will react to the dietary yeast and cause an immune reaction that can cause symptoms like a food intolerance. And then reducing the bloating, maybe you give carminatives, herbs, if needed. Okay. So antimicrobials, antifungals, gentian, wormwood, barberry. There's also a Chinese formula I sometimes use called intestinal fungus formula. I don't remember the Chinese name, and that works great as well. I like using that one over tinctures sometimes, is because it's easy to take 2 pills 3 times a day, and not everyone likes the taste of the tincture they get them. But I sometimes will use all of them. Also, garlic extracts and essential oils. Sometimes I'll do a tincture or the pills for a week, see how they do, and then I'll layer on, let's say, oregano oil either in drop form or as a tablet to make it work better, because sometimes the oregano oil can help disrupt the biofilms and make them more resistant to the herbs I give them, or antifungal drugs. Sometimes I'll recommend they take a garlic supplement in addition to that, like layer another thing on. Sometimes I'll get them to go to their doctors and go on oral antifungal as well. And there's a couple different ones that you can use. I'm not opposed to people using drugs if necessary. It depends. I've had cases where people were resistant to the drugs and they did great on the herbs. And I've had people where they did really well on the herbs, but I layered the drug on top to help really give that extra little kick as well. And then your carminatives. So here's a woman. She had chronic vaginal yeast infections since she's been 12 years old. She's been on several different antifungals, Canesten, Diflucan. She was unresponsive to those drugs. Those are the azole antifungals. I suspect she had some kind of drug resistance to them. She always had vaginal discharge. She has a number of digestive issues as well. And she also suffered from bipolar. And I've seen a lot of people with yeast overgrowth, or what I suspect was yeast overgrowth in their gut, that it affected their mood and in particular anxiety, like it really exaggerated anxiety. And so some of these people, they're like, I don't know, mentally, like I don't think I should feel this anxious, but I'm just feeling my whole body just feels agitated and anxious. And they're suffering from chronic bloating and vaginal yeast infections. And so the goal is to get rid of those. And so in this woman, what we found is we gave her D-gel, we gave her some garlic, we gave her some probiotics. She did much better, but her vaginal symptoms didn't improve. So D-gel obviously helped with the heartburn. Then we gave her a tincture that had barberry, podarco, clove, gentian, echinacea, a bunch of antifungals. I don't use that formula all the time. I use another one where it has golden seal, podarco, myrrh. Like I mix it up. So this is one that was years ago. And you can see after about a month of being on it, there's a dramatic improvement. And eventually, what was great is her vaginal candidiasis and her heartburn totally resolved. First time in basically 20 years almost. And again, the scale 6 is bad, like as bad as possible, and 0 is good. And what's also very interesting is that her well-being, it basically was a little aggravated after taking the tinctures and stuff because I think it got a bit of a die-off reaction. But then it became really stable. Kind of her moods were almost the most stable they've been in years. And I've seen this time and time again with clearing out yeast in the gut and seeing the moods improve. And there is a huge connection with mood and the gastrointestinal tract. Okay. Someone's asked me a question. When other dietary yeast, do you recommend I remove bread and beer? Yeah. So dietary yeast, kombucha, nutritional yeast, I usually get people to remove that. Mushrooms, less of an issue, but I get the people to remove that as well. Kombucha, I'm not a big fan of kombucha. I think it bugs all my patients, or a lot of my patients. I don't even know why it's good for you. So it seems to cause more harm than good. Also, chicken stock will have yeast in it. Certain foods, a lot of the soy products, like the soy burgers and dogs and things like that, they'll add yeast to give it that meaty taste to it as well, and that can bug people as well. So yeast bugs me. I get a rash. I get eczema and bloating when I eat yeast. Hemorrhoids, more of a skin issue than a digestive issue. Basically, you get the veins in the rectum become swollen, usually triggered by pregnancies, chronic constipation, chronic diarrhea, low fiber. So if you're straining a lot, it just builds up pressure, a lot of obesity. So in general, it can cause pain or blood. The main goal with it is improved bowel function, so more fiber. You got to be careful. You don't want to do too much fiber because that can also stretch out the tissues a little bit and cause irritation. Arrest the bleeding, so you get some astringent pads you could use, stool softeners, cold compress to decrease the swelling, and then a sitz bath with astringent and vulnerary herbs. So those are things that we've done. A little study I was reading talking about using honey topically and aloe gel topically seem to help with hemorrhoids. I've recommended witch hazel soap pads that you can just use to wipe to stop the bleeding also. Now liver disease, because we've got some cool cases coming up here. Liver disease can be caused by a whole bunch of different things. It can be caused by drugs, infections, also fatty liver disease, which we'll talk about in a second. So people often may or may not feel pain in the upper right quadrant. So in your right side, just above the ribs is where your liver is. And so might get some pain in there. usually produces elevated liver enzymes because the hepatocytes are being damaged, and they release these little enzymes that you can check on a blood test called AST and ALT. And they may produce some yellowing of the skin, jaundice, which can be associated with all sorts of different things. Okay, so with liver disease, there's lots of herbs that have been used for that historically. Most of these are hepatic herbs or cholagogues, choleretics that improve liver function. Some hepatoprotective herbs. A lot of them support liver detox. So in general, some of these things can be very helpful, but most important, you got to figure out what the cause of it is. So if someone's an alcoholic, giving them some milk thistle isn't as good as getting them to stop drinking. Or if they've got a hepatitis due to hep C, it's a viral cause, you may have to deal with that. Non-alcoholic fatty liver disease has got a huge connection to diet and obesity, and we'll talk about that in a second. So some hepatic herbs and hepatoprotective herbs: milk thistle, turmeric, licorice, ginger, yellow gentian. These are all great. Digestive bitters, many of these are called hepatics. So gentian again, chicory, dandelion are great. Again, licorice is not a bitter. Turmeric is not technically a bitter. Milk thistle is barely a bitter as far as I'm concerned. And there's some antivirals. Licorice is an antiviral. It's used against hepatitis. And there's a Chinese/Kempo formula called SST that's often used, or Shei Sako To, also called minor buclurum formula, that's used as an antiviral formula for hep C. And I have used that, and I think it works pretty good. I've got a really good case, but it happens to, I can't find it now because it was when I worked at Parkdale. And so I wish I could include that one. So fatty liver disease. Fatty liver disease is typically inflammation of the liver. There's elevated liver enzyme. Pain may or may not be associated with it. Sometimes nausea. And the way they diagnose is on ultrasound, they can see there's all sorts of fat kind of diffuse throughout the liver. And appreciate what a fatty liver is, or a non-alcoholic fatty liver disease basically means something's damaged in the liver that's non-alcohol. So you can get a fatty liver from drinking too much, because that can damage it as well and get scarring. But usually with the non-fatty alcoholic fatty liver disease, it's usually caused by poor diet, being overweight, eating too much, maybe a genetic predisposition, a lot of triglycerides, a lot of cholesterol, and also a lot of sugar. And so if you just force feed yourself, you just end up getting a fatty liver, kind of like when you make foie gras, like pate. They force feed geese, which is awful and unethical, and then the goose's liver becomes all inflamed and full of fat, and then we blend it up and eat it, and it tastes good. So not a good thing to do. So what you want to do for treating fatty liver that's not due to a virus and not due to alcohol is get the person to lose weight, improve their diet, get increased bile production and flow in general, so your cholagogues and choleretics. Recommend dietary things that help to reduce cholesterol and triglycerides. Give them hepatoprotective things and improve the gut flora. So probiotics have been shown to also help with fatty liver. So here's a neat case that I had. This is a 45-year-old woman, so same age as me, chronic abdominal pain, right under the liver, elevated liver enzymes on her blood test. She had sluggish bowels, chronic heartburn. So non-alcoholic fatty liver, food sensitivities, GERD, and IBS-C was what I diagnosed her with. So we did an IgG food sensitivity testing. We did some weight loss stuff, probiotic, magnesium citrate for the sluggish bowels, and then eventually I gave her a tincture. So these are her liver enzymes. So when she came in, which one? One of these is AST, one of them is ALT. I can't. Where's my legend? Oh, I got rid of it. So one of these is AST and ALT. I think ALT is the top one, and then the doctor didn't run it until later on. So initially she came in, those dotted lines are representing the normal values, normal range. So when she first came in, I did some dietary changes, got her to lose weight. She did great. After a few months, we saw both her liver enzymes had gone down dramatically. And so that was great. And skipping ahead to the next slide, We also saw her weight go down from that December to March situation. So that's great. Now, what happened after that? Between March and October, she kind of became less compliant. She's got kids, she's busy, you know, and it's hard to stay focused. So her liver enzymes went up. And that was because she wasn't following the recommendations I told her to do. Now, what's interesting though is, so at that point I told her to smarten up, and I said, look, your liver enzymes are elevated. I gave her a tincture with gentian, artichoke, milk thistle, bupleurum, which we didn't talk about, but it's another Chinese liver herb. It's in the minor bupleurum formula, and licorice. I told her to take that daily. And you can see that over time, her liver enzymes have almost normalized. I haven't seen her recently to check where liver enzymes are at, but she did really, really well, and the pain improved. Her heartburn got better. All of her bowels are doing great. So she loves me. But what happened was her weight went down dramatically again, and so that's great. But then she became less compliant again because she got busy over the summer with drinking too much, doing other things. So her weight went up. But appreciate the herbs were probably doing something, because yes, it could have been just diet and lifestyle for this reading, but she still wasn't compliant. And when her weight went up, it didn't follow the liver enzymes. The liver enzymes continued to go down despite the fact that the weight had gone up. So what I would conclude from this is that diet and lifestyle is what you want to do to treat fatty liver disease. But I feel pretty confident in giving someone these herbs because they have an additional beneficial effect on top of just doing the diet and lifestyle changes, so that even when the person is not perfect with their diet and lifestyle, which ideally they should be, there's still benefit. So I think that's pretty cool. And here's a study that talks about the benefits of milk thistle for non-alcoholic fatty liver disease, which is kind of nice. And that was one of the herbs in there. Now, gallstones, I've discussed a little bit before. Most gallstones are made from cholesterol. The main risk factors is poor diet, too much sugar, pregnancy, rapid weight loss, because if you're dieting a lot, then the gallbladder isn't moving as much as it should, and then cholesterol. So what a gallstone usually is cholesterol becomes supersaturated in the bile, starts to precipitate out of solution, forming stones. And so anything that's going to slow down the movement in the gallbladder is going to be an issue. Okay. I've talked about this already. Symptoms associated with it, you may get pain kind of where the liver is, but usually more of a stabbing, cramping pain called biliary colic. And it can be referred to between the shoulder blades or on the shoulders. It's pretty severe. So my general approach for treating gallstones is increase bile production, stimulate the gallbladder. So you're getting the bile as your solvent to dissolve more of the cholesterol stones. Stimulating the gallbladder means that you're basically getting more of the bile to flow over the stones to get that to sort of wash out the stones. You can also supplement with bile. I don't always do this with people, but there is research showing that taking oral bile supplements, and the bile would be obtained from an animal like a cow or an ox, and then put into a supplement form, that can also help dissolve stones. Remove food sensitivities, which there's no research to back this up, but I think that if we know that there are foods that can cause heartburn and sluggish bowels, and removing them makes those symptoms go away, I don't think those symptoms are in isolation. I think they probably affect, food sensitivities probably affect the movement of the gallbladder as well. So removing food sensitivities should cause an improvement in heartburn, IBS-like symptoms, digestive symptoms, and gallstones. It may help that. Improving diet in general is good. More fruits and vegetables, bitter leafy vegetables, reducing saturated fats and animal-based fats like pork is particularly bad, as well as a lot of the deep fried oils like corn oil and soybean oil get removed. Increasing omega-3s, so fish oils, flax, chia, and hemp are good. Those are good fats that seem to help with gallstones, and all those bad ones I mentioned from like certain animals, and corn and soy is all bad. And then I don't normally give a lot of vitamin C, but it seems to have a protective effect. So I wouldn't give supplement vitamin C alone, but in combination with the other things, it works. Now, some people I do only, let's say, the herbs with it and the diet. Other people I'll give herbs and supplement with bile and give omega-3s and give vitamin C. It depends on, I give the option to the patient, let them choose, because the more comprehensive approach is going to cost them more money. And I know the herbs alone will work. So what herbs? Antilytic, cholagogues, choleretics, bitters, Boldo, gentian, barberry, all those guys, antispasmodic herbs if there's biliary colic associated with it. Some gallstones are caused by an infection, and so you may use antimicrobial herbs for that as well. And then bulk laxatives can also help bulk up the stool and maybe help to pull some of that bile out of the system as well, forcing your body to make more of it. So I don't know if that makes a difference, but a low fiber diet seems to be a risk factor as well. There's a little summary of the various risk factors there that I've excess sugar, low fiber, high bad fats, fast food, low vitamin C, and then coffee, which is a great digestive bitter, seems to be protective. Okay. So here's a case, and this is a really cool case. So here, I'm going to skip to here. You can read the whole thing after. Young 18-year-old woman came in. She'd had gallstones for a couple of years. So we're seeing more and more teenagers with gallstones now because of their awful diet. And she'd eat donuts and Tim Hortons double doubles, or maybe tea. No, it wasn't coffee. She'd have double teas. And her parents didn't want to get her gallbladder removed, even though that's what the medical doctors wanted to do because she was so young. And so over a couple of years before I started seeing, she had ultrasounds done, showing she had gallstones about 1 centimeter in size. We changed her diet before this, so we started seeing her probably in 2004. We changed her diet. We saw an improvement in the cramping pains that she was getting due to the gallstones, but the ultrasound showed no significant reduction in the size with those changes. And then we started giving her herbs, and we gave her herbs for about 1 year. And after that year, had another ultrasound done in about a year and a half after the previous one, and basically showed no stones. And I think that's pretty damn cool. That's probably the only documented case of gallstones being dissolved with herbs, because although I'm not the only person who has done it, most people don't publish this information. So that's pretty cool. And I've also had these results with other patients. I sometimes have just used gentian alone with not gallstones, but biliary sludge. So it's like slush, like gallstone slush instead of like a big stone. It's like a whole bunch of little crystals just kind of clogging it up. And I've had that just removed that as well. So in general, what I find is that for the most part, I've had success with dissolving stones, but I've also had someone who had hemolytic anemia, which creates bilirubin stones. I didn't have success with them. And I had another case where I had a woman had a fatty liver and gallstones, and the herbs and everything we did, it cleared all that fat from the fatty liver. But what I think happened was all that fat got mobilized and went through the gallbladder. And so all that extra cholesterol stress on the gallstones and actually made them bigger after 3 months before they got dissolved. So even though we got rid of the fat from the liver, I think it probably made the gallstones worse before they would have gotten better. So I don't know for certain, but I think if she would have stayed the course, she probably would have gotten rid of her gallstones. But she got anxious because they were getting bigger, and she just decided to go get surgery done. Okay. So that's one cool case. A couple other cool cases with gallstones. Here's a 50-year-old man. He had one gallstone. He had gallbladder attacks several times a week. He also had heartburn, and he had psoriasis. His cholesterol was elevated, so were his triglycerides. And those are risk factors for gallstones as well. So him, we did, got to remove food sensitivity, got to eat his healthy breakfast, take a vitamin C supplement, and then I gave him a tincture that had gentian, artichoke, wild yam, barberry, wormwood. Some of those are antilytics. Some of them are antispasmodics. A couple of them lower cholesterol. The artichoke and the wild yam helps with cholesterol. I think the gentian does. I think they all do, probably. And so with this person, in September, this person had 10 gallbladder attacks and had heartburn on a daily basis. And by improving the diet and by following my instructions, 1 month later, only had a single episode of biliary colic, and that was after they ate potato chips, which they knew they weren't supposed to do, and they did anyways. Now, I haven't seen, because this is still a case I'm treating right now, I haven't seen any recent ultrasounds, and they won't do an ultrasound for maybe a year. And one of the problems I don't have more cases that, one, doctors don't always want to waste money by ordering more ultrasounds, and two, even if they get them done, sometimes I have a hard time getting my hands on them. So I've had lots of success treating this, but not as many like perfect before and after ultrasounds. It's just tricky to. Sometimes when people are feeling better and they're doing better, they don't come in and see me, because why would they bother, right? Also, the psoriasis improved with the dietary improvements and the herbs as well, which is cool. So another good case. And here's one more case for you. I think this is the last one. Here we had a 25-year-old male. He had poor digestive function, lots of food sensitivities. We did the blood test for him. He had tons of food intolerances. He had all sorts of really bad IBS symptoms. He had really bad gallbladder pain. He had sludge. He didn't have stones, but he had sludge under his gallbladder. So lots of digestive issues, all related to the food sensitivities. So that's the most important thing to address. But herbs were useful. So we removed the food sensitivities. He got the blood test done that confirmed a lot of the food sensitivities that he had. Initially, I gave him gentian to stimulate digestion, chamomile and peppermint for the bloating and digestive cramping, healthy breakfast on a daily basis. And then a few months later, I gave him a more comprehensive gallstone tincture. So I didn't start with that because I didn't know if it'd be necessary, and I didn't want to have him to take a lot of it, because there's also, you have to consider people's finances as well. So for him, he had really bad burping on a daily basis, a 9 out of 10. He had heartburn frequently over the week, about a 5 out of 10, and then he get this gallbladder pain that was kind of low and grumbling most days, and then occasionally you get some gallbladder attacks. And what we found is just the gentian, peppermint and chamomile tea, and removing the most common food intolerances, we saw a dramatic improvement over the month, which made him very happy. Then when he got his IgG results, we became even more strict, and by removing all of his food sensitivities, by June, we basically had his gallbladder pain completely resolved, and he also started taking his gallstone tincture in there as well, because he's getting these little flare-ups. His heartburn almost resolved, and his burping had almost resolved as well. Had gotten significantly better, which is great. And so this was the gallstone tincture that I introduced here. He had a few little episodes here that would come and go depending on what he would eat. He'd still have like an acute flare-up. So that's why I have the blue line is the daily, and sort of the other one is more of a like occasional flare-ups that were pretty severe. And then in June, I didn't see him for a couple months. And in the summertime, he was not as compliant. He kind of gone off doing the herbs. He was eating and drinking things he probably wasn't supposed to, and symptoms worsened a little bit, but at least his gallbladder pain had improved. So I probably, in that period of time, from February to August, that may have been enough time that we were able to clear the sludge that he had in his gallbladder. I don't have an ultrasound to confirm that, but that's what I'm suspecting, because the gallbladder completely resolved after a few months of taking the herbs, and didn't return even when he was bad, even though the burping and the heartburn got worse. It didn't get as bad as it was initially, because he didn't revert back to all of his old bad habits. He still tried to do it to some degree, but he still wasn't perfect. Okay, so it's 9:50, 11, oh, it's noon. So we're a little over here. Sorry about that. Question: do gallbladder flare-ups also tend to occur with healthy fatty meals? I don't think they do. I think it's the omega-6s that cause a bunch of prostaglandin releases that really cause that gallbladder to cramp. Now, I think even good fats will get the gallbladder to increase the motility of it, but I think the bad fats, maybe they exaggerate it and really get it to have more forceful contractions. I'm not sure, but it always seems like things like pork and deep fried foods are much worse than like olive oil and avocado. That's what I've observed, in salmon. So I think it's the bad fats that seem to make it worse. If you drink enough olive oil, you could precipitate a gallbladder attack just because you will get that. You know, if you drink a liter of olive oil, you're going to get that gallbladder pumping pretty strong, but it seems to be a little bit better. Okay. So what do you guys think of all those cases? You like those? Please give me some feedback, because I think they're pretty cool. And I like cases of stew. I'm just curious if I should add more or if you guys are indifferent. So I would say this is, I'm going to end it here for the lectures. If you want to stay on for another 15 minutes or half an hour, what I'll do is I'll go through some of the cases that I sent to you guys. Can spicy foods cause hemorrhoids? I don't know. They're associated with hemorrhoids. That's a question that came up. I'm not sure. I know that some people get hemorrhoids when they have spicy food. I don't know if they've always had the hemorrhoids, but now the cayenne just happens to be passing by those vulnerable tissues and aggravating what was already there. Okay. I'm going to turn off my screen. You can look at me and see where those cases are. I posted some. Some of the review. I posted all those. Actually, you know what? Put this back on. Camellia is asking, would black coffee help with gallstones? Black coffee is protective against gallstones. So people who have a history of gallstones, most of my patients are not coffee drinkers, which is, and there's research to back that up too. So yes, black coffee is a good digestive bitter for your gallstones. Any other questions? So if you guys, I don't know what you guys have right now. So if you have to go, and I'll just record this as well. Final exam practice questions. Oh, I just lost my connection to my mouse. Just 1 second. Okay. So I think these questions I've put up here should be self-explanatory. I might say in a question like, which of the following herbs is most indicated for warts? Is it A, bloodroot? Is it B, whatever, psyllium, etc.? So I don't think, if you go through those, that should all be explanatory. Some of the questions, I kind of made them generic, and so you got to figure out what I'm trying to tell you there. And so that's the breakdown there. I think 75 questions altogether. Formulations, there's going to be, let's say, 15 for most of the sections except for the cases, and you need to know the Latin names. So the Latin names, I'll basically tell you, like, what is the Latin name for golden seal? Is it Hydrastis canadensis? Is it Hydrastis aquifolium? Is it Gentian canadensis? Or is it whatever? Okay. So there's tons of overlap in this section. So I would say the formulations and safety stuff, some of those safety issues overlap from what you did in the initial part of the year. I would say the actions, the herbs, and the cases, that whole section, what makes up the bulk of it, there will be some questions that are, kind of similar but reworded in a certain way. Maybe one of them might be pick the best action. Another question might be, and you might choose like antidiarrheal, demulcent, bulk action might be associated with one question. Then you might say, what do you use bulking agents for? So there will be some repetition there for sure in some of the questions in order to get 75. And these are worth going through. So let's just, if you guys want, me to go through a couple of these things? We can just sort of. Okay, at least one person does. Two people. Good. So here we got Sally. She's a 35-year-old woman complaining of digestive issues. She feels bloated daily. So in my mind, what I would do is I would circle the bloating, and then I would write down in my mind, okay, if she feels bloated, what actions would I want with that? So I'm thinking, well, I could use carminatives for that. I also might want to use a bulk laxative for that because she could be constipated. And then I go on to the next, write down a couple things as you go. She typically feels a bowel movement every day or two. Oh, definitely want to have some bulk laxatives for that. Maybe some carminatives to help with there's any kind of cramping pain. She has a bit of a sweet tooth, lots of sugar there. She feels heavy after she eats meals and burps a lot. So she feels heavy. Sounds like she's got some indigestion, maybe some sluggish digestion. If she's burping a lot, maybe she's got that hypochlorhydria thing. So we want to improve digestive function. So we probably want to give a digestive bitter. She gets occasional heartburn that she alleviates with TUM. Okay, so she's getting occasional heartburn. That sounds like she's got a bit of a reflux thing going on here, probably due to atonic digestion. So then with this case, I might say, what actions would you want? Okay, so she's got poor digestion. So I would be thinking digestive bitters. She's getting the bloating, so I might give carminatives too, although I want to watch the carminatives because she's getting reflux. I don't want to overdo that because carminatives can aggravate heartburn. I don't think the bitters should aggravate her heartburn because it sounds more like a reflux kind of heartburn rather than H. pylori. So I'd recommend some digestive bitters, remove some food sensitivities, give a bulk laxative, and that would be either you could give her psyllium or as like flaxseed chia and things like that. So with this case, I probably would say give her a digestive bitter. What would be a good digestive bitter? I would say gentian. You could use other ones, but gentian's probably going to be the one that's going to come up on the exam for like a case like this. But you could use even golden seal, even though that's not the main indication, but it's a pretty strong bitter that would be useful. It's just not my go-to for this. And the bitter would help improve digestion. It should help with the reflux as well by increasing the stomach tone and keeping the contents inside the stomach and speed up the digestion. I might also give her an osmotic laxative if she needed it to improve the bowels. What I wouldn't do with this person is give her a stimulating laxative because her bowel movements, they're not that bad, and it would be unnecessary to give her like senna on a daily basis. Because she gets occasional reflux, I think it might be a wise thing to give her GERD, marshmallow, or slippery elm in some form to take as needed. She wouldn't have to take it all the time, but take it as needed. Okay, so that would be, so for the exam, I might say, which of the following actions would be good for her? And it would be A, a bitter, comma, carminative, comma, demulcent. Is it B, a stimulating laxative, comma, antiemetic, comma, bitter? Is it C, antimicrobial, comma, expectorant, or whatever? Okay, so then you have to go through and figure out which one would be the best one. And there's probably going to be overlapping things that, like, yeah, stimulating laxative you could do, but then read it because I may say long term on a daily basis, and you go, oh yeah, we can't give a stimulating laxative long term on a daily basis. First of all, it's not really indicated because he's not really acutely constipated. Second of all, you don't give stimulating laxative long terms. So that's why the bulk laxative selection with the bitters and the carminative would be a better choice. So let's go on to the second case. So here we have a 22-year-old with chronic bloating and gas. Okay, another person with bloating. She's had it for years. It got worse after she went on antibiotics. So when I hear that someone went on antibiotics, that's making me think there's some disruption in the gut flora. She's in good health and shape, normal weight. She gets distended abdomen. She looks pregnant sometimes. Sometimes she'll get loose stools and diarrhea with lots of cramping when she eats sugar. So now I'm thinking, okay, she's antibiotics, probably caused dysbiosis. Eating sugar, that's probably feeding the bug. Chances are she often feels worse eating bread and drinking beer. So to me, I mean, we can't say for certain, but it sounds like she probably has a bit of a yeast problem going on with this case. So for her, the chronic bloating and gas is less likely due to constipation because she's getting diarrhea and loose stools, and more likely to due to some kind of bug that's fermenting sugars and also some food sensitivities. So for her, the actions I might want with this case would be more of antimicrobials, carminatives would be the two big ones. Maybe an antispasmodic as well because of the cramping. So those would be things. Would I give a bulk laxative? You could. That wouldn't be wrong. Would I give a demulcent? Not really, because she doesn't have any kind of burning stuff. So that wouldn't be one I would give her. I wouldn't give an antiemetic. Would you give her a bitter? If I gave antimicrobials like Golden Seal, I would be giving a bitter, but it's not really the action I'm looking for in this case. Not the primary action. Wouldn't cause any harm, but it wouldn't be the main one. Would I give an antidiarrheal, like something like a strong astringent herb? Probably no, because she gets occasional diarrhea, and those astringents would be too suppressive, in my opinion. So I wouldn't bother. I would personally just give her some kind of antimicrobials, a probiotic, and then get her to avoid dairy and yeast-containing foods, and I'd probably get her to remove those other food intolerances just in case. But even though they're probably not the main thing. Daniela's asking me a question. Wouldn't a bulk laxative for Jane worsen the bacteria because of probiotic fiber are food for the bacteria? It could, but it may not. It could, but it may not. You just let people know that if this is an issue, if it aggravates, let me know. Sometimes, like I said, sometimes psyllium makes people more bloated, and sometimes it doesn't. Sometimes adding more fiber in with their breakfast, usually it's okay, but occasionally it makes it worse, but not too often, okay? So that's that case. So antimicrobials I might use for that one. Golden Seal, you could use Podarco, you could use myrrh I would use, wormwood you could use, clove you could use. I don't think we talked about clove. Oregano oil. So there's lots of different ones. A lot of those act as antifungals as well as antimicrobials and antiparasitics. So here we got Steve. He's 45 years old. He's got heartburn. He occasionally experienced it in the past, but it's getting worse. He gets it 2 to 3 times a week. He's under a lot of stress. He's normally a pretty healthy diet, but he's been eating more crappy foods like fast foods. So his routine's probably all over the place. He tends to get heartburn at night when he's laying on the couch or after dinner. Occasionally he gets it at night. He has poor appetite. When he does, he gets lots of burping with meals. Sometimes he gets some regurg. Spicy food and tomatoes make it worse. And he's got some elevated blood pressure and cholesterol. So with Steve's situation there, I would say that this is kind of a functional dyspepsia GERD presentation. And so because it happens occasionally and because of the components with it waking him up at night is worse when he's laying on the couch, he's had regurg before, I don't think this is H. pylori going on. There is a chance that it could be. So I can't say with 100% certainty that it's not caused by H. pylori, but because sometimes what can happen is when you're stressed out, that can affect your immune system and make you more susceptible to getting sick. But I've seen a lot of people present this way that don't have H. pylori. So I wouldn't start by thinking of dealing with the H. pylori. And like in an ideal world, if I could have the H. pylori test done and endoscopy and all those things done, that would be great. But this guy might present with me, and maybe the doctor's given him some drugs for it, but he doesn't want to take them, or he's tried them, but it hasn't really gone away. Then that's where I would give, let's say, the main thing I would want to do is promote digestion by giving digestive bitters. And at the same time, I would give him a demulcent herb. Might be a licorice marshmallow tea, might be a DGL capsule, might be just slippery elm or marshmallow by itself to take as needed, and those things would help. I'd get him to eat smaller meals. I'd recommend that he not eat too close to bed because that could make things worse. And hopefully by stimulating digestion, and you could give him gentian alone, but I could also give him gentian with a little bit of ginger in it, with some milk thistle or artichoke to help with his cholesterol as well. That might be a good herb combination because he's got elevated cholesterol. Throw in some artichoke in it as well. And that's what I might do. I probably wouldn't, like, an antacid would not be my primary action. An antimicrobial wouldn't be my primary action. My two primary actions would be one, demulcent, two, probably a digestive bitter in this case. The carminatives, not a primary action. If anything, it might make it worse at this point. Okay. So Elisa's got heartburn for the past year. She was diagnosed with H. pylori. She did the drugs. It helped for a while, but it seems to be slowly coming back. And so what would I do in this case? Now, in this case, the treatment of the heartburn is going to be different because I know she probably has H. pylori that maybe it wasn't fully cleared and it's returned. And maybe it was fully wiped out, but maybe her husband has H. pylori and she just got reinfected with it, for example, and that could happen. So in this case, what I would be inclined to do is the primary action I'd be looking at in this case would not be bitters, but would probably be demulcents, vulneraries, antimicrobials would be the three big ones. Now, I probably wouldn't add anything too astringent to this because I don't think it would be necessary. How I might treat this was I might make up, give her like marshmallow slippery elm. You could get her to take marshmallow, chamomile, and licorice in a tea form if you want to combine those. Or just get her to drink tons of chamomile tea. Chamomile can help heal the ulcer, might actually help clear out the H. pylori a bit. Give her DGL capsules to take as needed when she gets to heartburn. That would be appropriate to do. So drink the chamomile tea. That's cheap. Take DGL as needed. That's relatively inexpensive. Give them a tincture with herbs that would hopefully fight off that H. pylori. So some golden seal, some myrrh, some podarco. Start with that. See how she does with those guys. I might layer on other antimicrobial herbs after that as well if I didn't see they were working. Might do an essential oil, like oregano oil capsules or liquid. Maybe some garlic capsules as well. And I might also give her some antacid herbs. So I might include in my antimicrobial formula something like Filipendula meadowsweet. So I might have golden seal, meadowsweet, a little bit of licorice in it, myrrh, podarco. That might be a combination of herbs I might do. Carminatives, I doubt would be an issue for them. Like I wouldn't necessarily give them a lot. but it sounds less like reflux and more like a gastritis, inflammation of the stomach. And yeah, there you go. Baby Stewie is 8 months old, so not another case. His mother says he's colicky, he fusses a lot. She notices his stomach is distended and feels tight when he presses on it. He has a bowel movement every 1 to 2 days, very gassy. He's formula fed and some solid foods. He's negative for H. pylori. He gave them a proton pump inhibitor for the baby, and that's the treatment. So I saw a patient like this, literally. So it's ridiculous that I don't think the kid has H. pylori and should be on these drugs. These drugs should not. It doesn't make any sense to have a kid on this. Anyways, in this case, what do you guys think? The primary thing is going to be food intolerance. So that's what we have to identify. Probably dairy. If he's on a dairy formula, then switch him over to a different type, maybe a soy-based one. If he's eating solid foods, watch out for the eggs and the milk and those other things I've discussed. With regards to herbs, if he's gassy, I probably would do chamomile, fennel, anise, peppermint, some kind of combination like that. So the main thing I'm looking at is main herbal action would be a carminative, maybe a bulk laxative, but I wouldn't necessarily supplement. I might get him to eat like kiwi, which has got some fiber and also some osmotic effects, and maybe like work on fruit in his diet, maybe some fiber in the form of like chia and hemp, for example. Probably a probiotic. But I don't think I would bother giving him a stimulating laxative. I don't think I would give him any digestive bitters. I don't think I would give him demulcents necessarily. So a 28-year-old woman comes to your clinic with nausea for the past 2 weeks. She feels sick first thing in the morning, vomited twice, very poor appetite, really tired. She thinks she's got a stomach flu. So what do we do for her? Well, if you have a young woman complaining of nausea in the morning, you got to rule out pregnancy first. Sometimes they may have been using condoms or she's on the pill, but they're not always effective. Identifying whether she's pregnant is important because if she is, there's certain things you do not want to use. Regardless, offering her to she could take an antiemetic herb like peppermint oil. Smelling the essential oil can relieve the nausea, and then drinking ginger tea. Both those two things would be safe to give to a pregnant woman, so you could start with that. Whether it's pregnancy, that's sort of self-limiting after a few months, and the stomach flu is usually going to go away as well. But it's important. Your job in this case is to not, even if she says stomach flu, you got to be smart enough to go, ooh, I don't want to give a bunch of herbs that may not be safe to give during pregnancy if I'm not 100% certain. So it's always something to be on your radar. Another case, so here you are traveling abroad and you haven't had a bowel movement in 3 days. You feel very bloated and gassy. Occasionally you get some cramping pain in your lower abdomen. So what do you do? I always travel with magnesium citrate. This person is acutely constipated, so I would probably take a stimulating laxative or an osmotic laxative. If I brought magnesium, which I usually do when I go on trips, just for the muscle pain, this helps with sleep and good for the bowels, it's a great one. For the bloating and gassiness, if I get the bowels moving, that will no longer be an issue. So some kind of laxative would be indicated at this point. And then taking a carminative along with it can help relieve the bloating and gassiness and help to normalize the peristalsis. And so things like any of the culinary little spices and seeds like fennel, anise, caraway, dill, they could all help. Drinking chamomile or peppermint tea would also relieve the symptoms and then get those bowels working if you can. So here we've got Maria, another case. Maria is a 42-year-old woman with gallbladder pain. So she gets pain under her right rib, especially with fatty meals. She's confirmed she's got a couple gallstones. Her doctor recommended she have her gallbladder removed, but she doesn't want to do this. She typically has a bowel movement daily, but does not feel like she fully evacuates the bowels, and she does not drink coffee. So we know she's got gallstones. She may have food intolerances. Most people do. It may or may not contribute to this. There could be other reasons. So, oh, Emily's lost sound. Emily, you back yet? Okay, good. So, with this case with Maria, she's got gallstones. So, what do we want to give? One of the herbs you want to do is antilytics. So, you want to try to dissolve the gallstones. That would be the primary thing. Another thing you'd want to give is a digestive bitter, because indirectly that's the same thing. So what it's going to do is you could also say you want to give a cholagogue and choleretic. So those are all kind of overlapping, but they're all indicated for this case if we know she has gallstones. Also can help with the bowels if they're a little bit sluggish. But in addition, for the gallstones, if she's getting cramping pain, that's called biliary colic. So you could end up giving herbs that have an antispasmodic effect. I would consider doing that as well. The other thing you might want to do is recommend a bit of a bulking agent for her bowels. So the herbs might help indirectly improve the bowel movements, but having a little more fiber in a diet, whether it's through sort of that breakfast I was describing or whether that's supplementing with psyllium, that might be indicated as well. So herb-wise, I would probably consider doing something like gentian as a bitter. I could use boldo, which is a good herb for gallstones, but a lot of these bitter ones are. I might also consider using wormwood. And wormwood, in some tradition, it's a digestive bitter that can be used to improve like your overall digestive effects and improve bile flow and everything else. It also has a bit of an antispasmodic effect. So some books talk about how it has a specific, in the German tradition, a specific indication for biliary colic as well. And so I might use that in my formula. I'd also probably consider using wild yam, which is an antispasmodic herb, which helps lower cholesterol levels and also has a positive effect on calcium excretion or cholesterol excretion. So I might have, let's say, gentian, wormwood, boldo. I could throw, if you had elevated cholesterol, I might throw in some artichoke heart or artichoke in that as well. That wouldn't be wrong. So those would be kind of my tincture. And then for the bowel movements, probably just give her a bulk laxative like psyllium or flax or chia or something like that. Improve the diet a little bit. And that's what I would do, okay? So with all those cases, I could ask questions like, which of the following herbal combination would you use? And I would say a herb that contains, or the tincture that contains, for example, gentian, boldo, wild yam, or B, senna, licorice, ginger. And what you want to do when you go through the questions is circle if there's something like that doesn't make sense there. Like if you're like, I don't think it makes any sense to use a stimulating laxative, then you circle that in the question, and then you go on to the next one. And if you find that, you find one that all the actions make sense, and you go with that one. Or all the herbs that make sense, you go with that one. Okay. Okay. So I want you guys to do great on the exam. Is there any other questions you guys have? Is that helpful? Do you guys feel like these cases and questions you should be, prepared for this exam? Do I have any of you guys left? I got some of you guys left. Good. Anything else I need to do for you guys? I got to post this lecture, but beyond that, I think that's good. Okay. Well, I think we're good then. Oh, shirt's wide open. Sorry about that. Okay. So you guys, good luck with the exam. I hope you have a wonderful summer. It's been a pleasure teaching you. If you see me in person, please come and introduce yourself and say hi. Because didn't get to meet any of you guys, only a few of you guys in person. I think when I was at the college one day. Um, and if there's anything that you think that could make the course better, you let me know. And I appreciate your feedback. Um, Best of luck. And if you need to answer any questions, need me to answer questions, you can post them on the forum if you want. I can answer them there, or email me and I'll go respond that way. Okay. Good luck. Take care. Bye for now.